Veterinarians have a wide array of products for use against internal parasites. The importance of these products is not only to relieve suffering and disease in the animal, but also to prevent transmission of disease to humans. In this latter capacity, veterinarians and veterinary technicians play an important role in helping to protect animals and citizens of their own communities through knowledge and proper application or dispensing of these antiparasitic products. There is a wide variety of antiparasitic chemicals and compounds, some of which are legend compounds, but others are over-the-counter and available almost everywhere, from the smallest local grocery stores to the nearest mega retailer. To complicate matters, 2 governmental agencies regulate these products. The Food and Drug Administration controls products that are either administered internally or absorbed significantly into the body if administered topically. FDA products are considered to be drugs and contain the legend on their label that requires dispensing by or on the order of a veterinarian. In contrast, any products that are applied topically and not absorbed to any great extent systemically are considered pesticides and therefore are regulated by the Environmental Protection Agency. Because the EPA does not require their products to be regulated other than very toxic insecticide applications that can only be used by regulated pest control operators, topically applied veterinary products are sold OTC or available through the mail. Several new parasiticides are launched every year. Product manufacturing companies spend millions to entice consumers to purchase an OTC product on their own while shopping for groceries or other daily living supplies. However, legend products that can only be obtained through veterinarians are not protected from direct-to-consumer marketing by expensive advertisements that end with the use of the phrase borrowed from their human drug counterparts. Ask your veterinarian about. In addition to the traditional medium of television and all its permutations, the internet is full of strong marketing messages that promise much to consumers seeking relief for their pets and themselves. Thus, veterinary professionals must spend a good deal of time and energy to stay up to date with the most recent products released, what they actually can and cannot do, and sometimes counter or bring into perspective the information the public is being told about the product. Because veterinarians and veterinary technicians have a responsibility to protect pet and animal owners from diseases potentially transmitted to humans via animal internal or external parasites, they often must be equally as aggressive with information to avoid consumers opening themselves to the possible injury or illness because of inadequate parasite control. For example, some zoonotic diseases passed by parasites from animals to humans can be especially devastating to people who are immunocompromised because of disease, medications, or therapies for autoimmune diseases. Such individuals may believe that they are adequately protecting themselves by purchasing an antiparasitic product they saw strongly marketed in the media, when in actuality the product may not control key parasites that pose the greatest threat to their health. A veterinary professional would be able to identify this gap in parasite protection and advise the animal owner otherwise, but if they never get the opportunity to talk to the owner, the veterinary professional's advice will be unheard. Even people who do not have special needs or conditions are at increased risk for disease because parasite exposure can cause parasite-transmitted diseases if they do not purchase the appropriate product. Parasites can be found in almost any environment regardless of how clean that environment may appear to the untrained eye. GI tract worms can infect humans through accidental ingestion of the parasite eggs from fecally contaminated soil, or other worms can migrate into the skin of humans sunbathing on a sandy beach where a parasite-infected dog defecated, or pet owners can be exposed to bacterial infections by being bitten by an external parasite brought into the house by the pet. External parasites like ticks and fleas can transmit Lyme disease, Rocky Mountain spotted fever, bubonic plague, and other diseases. Thus, control of parasite populations is a critical aspect of the veterinary professional's responsibilities that affects all people who own animals or are in contact with animals. Because the veterinary technician is often the person communicating with clients and animal owners, the veterinary technician must understand common parasites, their life cycles, the threat they pose to animals and humans, and what current products are effective against the parasites. As stated previously, many products are released each year, and it can seem daunting to keep up with all of the products available and what the marketing media is saying about these products. However, in analyzing the new products, it is common to find that many contain old compounds or chemicals that have been available and used in veterinary medicine for decades. Others will combine 2 old products into a new formulation, and others will take a new product and combine it with an older one to expand the number of parasites controlled. Other products will use an old product but package the delivery system into a new product that claims to be easier or cost-effective to apply. Finally, there have been some breakthroughs that have brought genuinely new compounds to market. But even then, the new compounds often share a resemblance chemically or through their mechanism of parasite control with an older compound. Therefore, the information presented in this chapter represents an overview of the key antiparasitic chemicals or agents that are incorporated into the plethora of OTC or veterinary products available for use in 2015. As with other drugs discussed in this text, the names used to describe the compounds are the non-proprietary names to reduce the number of compounds to be remembered. Although, as a general rule, students and veterinary professionals are strongly encouraged to use non-proprietary names for drugs in communicating with each other and clients. For antiparasitic compounds, the veterinary professional really must know both the non-proprietary name and the active ingredient and the proprietary or trade name. The trade name is so heavily entrenched in the public culture and media that it is the only product name that the client is going to recognize. However, by knowing the non-proprietary name for the active ingredient, the veterinarian can sort through all the products and identify which brand names actually contain the same basic active ingredient. By understanding the fundamental uses and limitations of each of these non-proprietary named antiparasitic compounds, the technicians should be able to understand how new antiparasitic products or new combinations of multiple products work without having to learn an entirely new compound. Although this chapter will provide a good foundation for understanding these compounds, it is still the responsibility of the veterinary technician and veterinarian to continue to educate themselves about the latest released antiparasitic products through journal articles, advertisements in veterinary trade publications, and information available at veterinary medical and veterinary technology conferences and conventions. Many drug companies choose to launch new products at the major veterinary conventions to gain wider exposure for potential sales. Hence, these major conventions are good places to learn about the most recent products available. If one believes the marketing advertisements on modern antiparasitic compounds, it would be easy to believe that these products readily remove all important parasites, easily, safely, and practically without thinking. However, intelligent decisions about which products to use need to go beyond the aggressive marketing pitch, attractive financial incentive offers, or comfort with a particular product that has always worked in the past. Therefore, when selecting an appropriate antiparasitic compound for use, the following characteristics of the ideal parasiticide should be considered. Selective toxicity. Selectivity toxicity means that the antiparasitic compound should be highly toxic to the parasite but should have little adverse effect on the host's tissue and the person applying or administering the product. Economical. An economical yet effective product is most desirable for the treatment of parasitism. Economics is one of the most critical factors in the selection of a parasitic control agent in livestock production, where the cost of a product used on the animals must be weighed against the potential economic return on the investment. Economics plays a much smaller role in equine or small animal parasite control, effective against all parasite stages with one application. Ideally, internal antiparasitic drugs should kill all the adult parasites and any migrating larvae or immature forms with a single treatment. If a compound only kills adult worms living in the lumen of the GI tract but fails to kill the migrating larvae that are moving through the rest of the body, the larvae will form new adult worms in a few weeks to continue the infection. Likewise, external antiparasitics should be effective with one treatment or very convenient to reapply to assure client compliance and effective disruption of the parasite life cycle. Failure to break the life cycle means the animal is highly likely to be reinfected in a few weeks, safe for old, very young, pregnant, or debilitated animals. This population of animals typically does not metabolize or eliminate toxic compounds, the parasiticides, and younger, healthy animals with fully functioning organs. For pregnant animals, any chemical or drug used must take into consideration exposure of the compound to the fetus and any potential teratogenic, i.e., birth defect generating, effects or detrimental effects on the pregnancy itself, and does not induce resistance in the target parasite. Like antibiotics, there has been increasing concern about the resistance of parasites to antiparasitic agents. This issue has been controversial in heartworm prevention medications and antiparasitic compounds used in equine or livestock products. Although resistance is sometimes difficult to document, e.g., owner non-compliance with proper application of the product is always a confounding factor in trying to prove whether resistance exists or not. It has been documented in several internal and external parasite species. Selective pressure, see Chapter 10, resulting in the emergence of resistant mutated parasites has been documented. Therefore, any product available OTC or through veterinarians should be highly effective to avoid the development of parasite resistance. Other desirable characteristics include a fragrant odor or lack of offensive odor in external antiparasitics, and environmental safety, i.e. the product breaks down quickly in the environment and does not enter the groundwater aquifer. Unfortunately, no single antiparasitic product incorporates all these ideal features, although over the years, products have become much safer for the animal owner, the animal, and the environment, and more selectively effective against disease-causing parasites. Veterinary professionals should still understand the specific needs of the animal and client, the environment in which the product will be used, and the characteristics and limitations of the antiparasitic product to make a rational, economical, and safe recommendation. Today's veterinary clients are savvier about their animals' health. Therefore, by explaining the reason behind the specific interval for dosing the product, the proper application method, the site for the product application, and any changes in the environment the client needs to make to break the life cycle, e.g., cleaning up dog feces in the yard. Client compliance with the instructions will be enhanced, increasing the odds of breaking the parasite life cycle and successfully controlling the parasitic infection. Internal antiparasitics. Although many discussions about parasites break them down into internal or external parasites, many compounds today are capable of killing both. These types of compounds are called endecticides, so named for their ability to kill some endoparasites, internally living parasites, and some ectoparasites, externally living parasites. This section discusses compounds used to kill or control parasites that reside primarily inside the body. However, some of the reagents will also be discussed in external antiparasitic section. Terminology used to describe internal antiparasitics. Various terms are used to scientifically describe internal antiparasitics, along with terminology used by marketing firms to promote a particular product. To sort through the sometimes confusing terminology and better understand the effects, targeted parasitic species, and the limitations of a particular product, the veterinary technician should master the basic descriptive terminology. Anthelmintic is a general term used to describe compounds that kill various types of helminths, or internal parasitic worms. Anthelmintics may also be described as a vermicide that kills the worm, or as a vermifuge which only paralyzes the worm and often results in the passage of live worms in the feces. Most products today are vermicidal and result in the death and digestion of internal parasites. In many cases, no evidence of intact worms is seen in the stool of the infected animal after the worms have been killed. Antinematodal compounds are anthelmintics used to treat infections of nematodes or roundworms. The use of the term roundworms can be confusing because it is also often used to describe a subset of nematodes found in the GI tract of animals that are large enough to be observed passing in the stool, like spaghetti, e.g., Toxocara species, Toxoscaris species. This subset of nematodes is also sometimes referred to vaguely as ascarids. All nematodes are technically roundworms whether they fit into this subset or not, because when cut in cross-section they are round in appearance. To avoid confusion when using the term roundworm, the specific species name of the nematode, e.g. Toxocara, Toxoscaris, should be used in describing the parasites. The classification of worms that fit into nematodes is very large, and because one antinematodal does not kill all nematodes, knowing the specific parasite names is important for selecting the appropriate antinematodal to use. Anticestodal compounds or cesticides treat infections of cestodes, which are tapeworms or segmented flatworms. Anticestodals are sometimes referred to as tiniicides, an older term that takes its name from the Tinea species of tapeworm. Again, a particular cesticidal drug may not be effective against all species of tapeworms commonly encountered in veterinary practice. Therefore, the veterinary technician should carefully read the package insert to determine the drug's spectrum of anticonvulsant activity. Antitrematodal compounds treat infections of trematodes, which are flukes or unsegmented flatworms, including Paragonomus, Fasciola, and Dicrocoelium parasites. Antiprotozoal compounds treat infections of protozoa, which are single-celled organisms such as Coccidia, Giardia, and Toxoplasma. Coccidiostats are antiprotozoal drugs that specifically inhibit the growth of coccidia. Many antibiotics like the sulfonamides and the fluoroquinolones also have antiprotozoal properties. Many of the parasiticides today have a broad spectrum of activity. Drugs that are antinematodal may also be anticestodal and have additional effectiveness against external parasites. Thus, the classification of drugs as antinematodal versus anticestodal or internal parasiticide versus external parasiticide has blurred in the past few years, e.g., the endecticides. Thus, many of these products mentioned in one category, i.e., antinematodal, anticestodal, internal parasiticide, external parasiticide, will be mentioned in multiple sections. Antinematodals. Ivermectins and milbemycins, the macrolides. Thanks to the 1976 discovery that a Streptomyces bacterium growing near a golf course in Japan possessed a broad range of parasiticide and insecticide properties, a group of revolutionary new, safer compounds with broad spectra of activity became available to the veterinarian in the 1980s. This group includes the ivermectins, i.e. ivermectin, salamectin, doramectin, and aprenomectin, and the milbemycins, i.e. milbemycin, oxime, and moxidectin. Interestingly, the milbemycins had been discovered and were being used against agricultural pest insects for at least 3 years before the ivermectins were discovered in Japan. It was only when it was discovered that the structurally similar ivermectins had excellent activity against a wide variety of internal parasites that the milbemycins were then developed for use as anthelmintics. Thus, even though they were discovered first, milbemycin did not hit the veterinary market until well after the first ivermectins, specifically the ivermectin products, were already well established as internal parasiticides. To keep the multitude of compounds and their uses straight, the veterinary professional must remember that ivermectin, e.g. Heartgard, Ivomec, Iverheart, Zemectarin for horses, Selamectin, e.g. revolution, milbemycin, e.g. interceptor, sentinel, trifexis, milbemite, otic, moxidectin, e.g. prohart 6, cytectin for cattle, quest for horses, doramectin, e.g. dectomax for use in livestock, and eprinomectin, e.g. eprinex, and long-range for use in cattle are all structurally similar and have similar mechanisms of action. The macrocyclic ring found in each of these compounds gives rise to the collective name for the group as the macrolides or macrocyclic lactones. Thus, when hearing these various terms, i.e. macrolides, avermectins, or milbemycins, remember they are all members of the same set of commonly used veterinary products. The macrolides, like most of the modern antiparasitic drugs, are neurotoxins. Most of today's antiparasitics target specific receptors on neurons to selectively enhance or inhibit the activity of specific neurons or to enhance or inhibit the effect of the neuron's neurotransmitter. Thus, mechanisms of action for antiparasitic drugs usually involve a specific type of neuronal receptor or a specific neurotransmitter. For the macrolides, the mechanism of action inside the insect or parasite is primarily through stimulation of a receptor site for the neurotransmitter glutamate. The glutamate neurotransmitter in invertebrates normally stimulates the glutamate receptor, which opens a channel in the cell membrane that allows negatively charged chloride ions to flow into the cell. The negative charge that is carried into the cells by the chloride ions makes the inside of the cell more negatively charged. As described in Chapter 5 about cardiovascular drugs, for a neuron or muscle to depolarize, i.e. fire, the charge inside the cell must become more positive from its resting state until it reaches a threshold charge level, at which point sodium channels open up, allowing a flood of positively charged ions to enter, making the inside of the cell very positive. If negative chloride ions have flooded into the cell as a result of stimulation of the glutamate receptor, the inside of the cell is more negative than normal, meaning the resting charge, called the resting membrane potential, is farther away from the charge level needed to cause depolarization. The net result is that the neuron or muscle cannot depolarize and there is paralysis of the muscle or no firing by the neuron. In parasites, this glutamate receptor-stimulated muscle paralysis affects the pharyngeal muscles, i.e. they cannot swallow, and the muscles associated with movement, i.e. they cannot move. Internal parasites starve to death or, if located in the GI tract, are moved away from their infection site and die. The absence of these glutamate receptors in tapeworms and flukes explains why the macrolides are largely ineffective against most members of these parasite classes. Although macrolides as a group are considered to be very safe compounds with a fairly selective toxicity and wide therapeutic index, see Chapter 3, they do produce a well-documented toxicity in susceptible animals or those that receive an overdose of the medications. When such toxicities occur in mammals, they are not mediated through glutamate receptors on the muscles or peripheral nerves because mammals do not have glutamate receptors in these locations. Instead, avermectins and milbemycins can combine with another receptor for a transmitter called gamma-Y, aminobutyric acid, GABA, which, like glutamate, causes an opening of chloride channels and subsequent inhibition of neurons in the CNS, primarily the brain. The GABA neurotransmitter and receptor were key components of the mechanism of action of the benzodiazepine tranquilizers and other drugs like propofol, see Chapter 8. Fortunately, the GABA receptors targeted by avermectins and milbemycins are located within the CNS and therefore safely protected from exposure behind the blood-brain barrier. Still, lipophilic drugs can readily diffuse through the blood-brain barrier and could potentially gain access to the GABA receptors in mammalian brains, producing toxicity. So why does toxicity not occur in animals every time a macrolide is administered? In addition to the cellular membrane part of the blood-brain barrier, another component of the barrier is the presence of a special protein pump called P-glycoprotein, PGP, whose function is to move drugs from the brain side of the blood-brain barrier back into the blood. Therefore, even though macrolides can diffuse from the blood across the tight cellular membrane of the blood-brain barrier and enter the brain, the PGP pumps them back into the blood before they can combine with GABA receptors on neurons in the brain. It is important to note that PGPs are also found in the liver, where they transport drugs from the blood into the bile for hepatic excretion, and also exist in the cells lining the GI tract, where they move selected drug molecules from the GI tract wall cells back into the lumen of the gut. Because the effectiveness of the blood-brain barrier against macrolides is so dependent on the PGP pump, anything that impairs the PGP effectiveness allows macrolides to accumulate within the brain, increasing the risk for toxicity. There are two ways that this can happen. The PGP can be inhibited by other drugs, or the PGP itself can be defective. Although the list of drugs that inhibit PGP includes a few drugs used in veterinary medicine, e.g. calcium channel blocker antiarrhythmics, cyclosporin immunosuppressant, antifungal agents ketoconazole or etraconazole, toxicity from macrolides because of less effective PGP pumping originates mostly from defective production of the PGP itself. Collies and other related breeds have a genetic defect in the gene that codes for their PGP. This gene is called the MDR1, multiple drug resistance 1, gene because it produces the PGP found on the surface of cancer cells that pumps out any anti-neoplastic drug that makes it into the cancer cell, making the cancer cell resistant to the drugs. This same gene has been more recently called the ABCB1, ATP binding cassette type B1, gene for the type of protein it produces. Animals that have the MDR1 genetic defect produce PGP that is either partially or totally impaired. Without functional PGP pumps in the blood-brain barrier, drugs like the macrolides can gain access to the GABA receptors in the neurons of the brain and inhibit their ability to depolarize. Non-collie breeds now show sensitivity to macrolide drugs, and genetic testing is available to determine whether a dog has this MDR1 genetic defect. See Table 12.1 for the frequency of MDR1 mutation in dogs as measured and reported by the Washington State University College of Veterinary Medicine. Macrolide toxicity because of genetic defect or from a very high dose of the macrolide that overwhelms the PGP defensive mechanism produces signs associated with CNS depression. Thus, the animals hypersalivate, vomit, become ataxic, stagger, and progress to depression, unresponsiveness, bradycardia, mydriasis, i.e. pupil dilation, loss of menace response, i.e. do not respond to a hand moving toward the eye, and coma. Prolonged seizures have been reported in some dogs along with meiosis, i.e. pupillary constriction, but it was thought that these may occur in animals secondary to brain injury caused by brain hypoxia, i.e. low oxygen. There is no antidote for ivermectin or milbemycin toxicosis, and the persistent nature of these macrolides can require that the animal be kept alive in a comatose or severely depressed state for days to weeks before the effects of the drug wear off. See clinical application for a couple of cases of ivermectin toxicosis. To kill most parasites, only small concentrations of macrolides need to be present in the tissues or fluid compartments where the parasite lives. The lipophilic nature of macrolides explains how ivermectins and milbemycins can readily penetrate many tissues and persist at low, but still effective, concentrations for a long period of time. In addition to internal parasites, macrolides are effective against mites, sucking lice, and feeding ticks when administered systemically by oral or injection routes, because they can penetrate into the tissues and the tissue fluid where these parasites are located or where they feed. Unfortunately, the lipophilic nature of macrolides and their penetration into milk means no injectable macrolides can be used in actively milking dairy cattle because of milk contamination for an extended period of time. Despite their inherent lipophilic nature, topically applied macrolides are often formulated to reduce their ability to penetrate deep into the skin where the drug might be absorbed systemically. Macrolides are excreted intact by the liver into the feces. One benefit of this is that feces from treated livestock or horses can kill flies or fly larvae that contact the feces. Part of the efficient excretion of the drug from the blood into the bile of the liver is because of the presence of PGP molecules in the liver that actively secrete macrolides into the bile, which then flows into the duodenum. However, because macrolides are lipophilic, they readily move across the GI tract wall. If not removed by the PGPS in the cells lining the GI tract, the macrolides will re-enter systemic circulation, enterohepatic circulation, see Chapter 3. The enterohepatic circulation, in conjunction with the persistence in the tissues, explains the long-lasting effect of these drugs in the body. Because macrolides are excreted intact into the feces, significant concentrations of the antiparasitic compound can accumulate in the feces. Dogs that have a habit of eating horse feces can ingest a significant dose of the ivermectin or milbemycin that was administered to the horse a few days before, and if the dog is a collie-related breed or has the MDR1 gene mutation and ineffective PGP, this could be sufficient drug to produce potentially severe toxicity. Thus, horse owners should be vigilant in collecting and properly disposing of horse manure in a way that dogs do not have access to it for at least 4 days after the macrolide was administered to the horse. Within the past few years, the question of resistance of parasites to ivermectins and milbemycins has been raised. A strain of heartworm isolated in Georgia, the MP3 isolate, was found to have increased resistance to several of the macrolide heartworm preventives when used prophylactically as a prescribed single dose, but was susceptible to 3 consecutive monthly doses. Still, the studies concluded that there are pockets of resistant heartworms, but the degree to which the resistance exists is still not known. This will be a topic in veterinary medicine that will continue to evolve over the next few years. Ivermectin was the first macrolide to be available for use in veterinary medicine. Its wide spectrum of activity includes everything from heartworms and intestinal parasites to external parasites. In addition, veterinarians have used the drug for many extra-label, not FDA-approved applications. It was, and still is, quite common to see ivermectin listed in the veterinary literature as an experimental or extra-label treatment for internal and external parasites in a wide variety of exotic animals, wildlife, avian species, and non-conventional household pets, e.g. hedgehogs, snakes, other reptiles. Many dosages also exist for the use of ivermectin in dogs and cats to treat extra-label parasites such as demodectic mange, ear mites, microfilaria of the heartworm, and a wide variety of less frequently seen internal parasites. As long as the use of the drug complies with extra-label drug use requirements in animals, including those animals intended for use as human food, these uses are mostly considered prudent and acceptable. Because of its spectrum and success in treating parasites, ivermectin is incorporated with other anthelmintics to produce parasiticides with a wider spectrum of activity. For example, HeartGuard Plus is a combination of ivermectin for the prevention of heartworm disease and pyrantel pamoate, an effective drug for the control of intestinal ascarids, i.e., roundworms. Iverheart Max has the same ingredients as HeartGuard Plus, but expands the spectrum to tapeworms by also incorporating another drug, praziquantel. Other combination drugs are currently available, and others are likely to be released in the future. By understanding what each drug in the combination does separately, the veterinary technician can more easily understand the spectra and potential side effects of these combination drugs. As with most other ivermectins, ivermectin requires very small concentrations to be effective against parasites. For example, the normal dose of ivermectin needed to prevent heartworm infection in dogs is measured in micrograms of drug, or about 0.06 mg of body weight. At that dose, even collies with MDRI mutation and poorly functioning PGP should be able to tolerate the drug. Toxicity reported in such collies is about 0.1 mg/kg, 16 times the 0.06 mg/kg dose needed to prevent heartworms, and death has been reported with a dose of 0.2 mg/kg, 32 times the preventive dose. Even though the effective dose of these drugs is well above the doses that produce toxicity, even in collies with MDR1 mutations, the manufacturers warn that collie-related breeds should be observed for signs of ivermectin toxicosis for AH after administration of the monthly heartworm preventive. Typically, ivermectin toxicity in dogs is not associated with the use of small animal products, but more commonly reported with the accidental exposure to large animal products, e.g., ingesting discarded equine paste syringes, or the extra label use of large animal products in small animals, e.g., using large animal ivermectin injectable to kill heartworm microfilariae. Selamectin revolution is an avermectin-type macrolide that entered the veterinary market after ivermectin and milbemycin oxime. It was targeted as a broad-spectrum insecticide approved for use as a heartworm preventive that is also effective against several GI tract worm parasites and external parasites, principally fleas, ear mites, sarcoptic mange, and one tick species. Unlike ivermectin, which is available primarily as oral or injectable dosage forms, selamectin was approved as a monthly topical application in both dogs and cats. The topical application route first used in small animals for selamectin has since been adopted by newer antiparasitics for its convenience. Dogs absorb only about 4% of the applied drug systemically, but cats, because of the different thickness of their skin, absorb closer to 74%. Because of the greater absorption of the drug in cats than in dogs, selamectin is also approved in cats to remove the hookworm Ancylostoma tubiiforme and the cat roundworm Toxocara cati. Although selamectin can kill roundworms in dogs and lungworms in cats, the drug is not approved for these indications. For dogs, moxidectin is available as both an injectable for 6 or 12-month heartworm preventative and hookworms, ProHeart 6 and ProHeart 12, and as part of a topically applied combination product with imidacloprid, Advantage Multi, that is approved for heartworm prevention, treatment, and control of common GI tract nematodes, e.g., roundworms, hookworms, whipworms, and treatment of sarcoptic mange and fleas. The combination product of moxidectin, Advantage Multi, is the only antiparasitic product FDA approved for eliminating the circulating microfilariae of heartworm in dogs. The injectable ProHeart 6 was originally released in 2001, but in 2004 the manufacturer voluntarily recalled the product because of FDA concerns over reported excessive adverse drug reactions. After additional testing, it was found that some residues left in the product from the manufacturing process had the capability of producing an allergic type of immune reaction that was thought to be tied to the severe reactions and death from the drug. After this compound was removed from the manufacturing process, reports of adverse reactions in overseas markets where the drug was still in use declined significantly, and in 2008 ProHeart 6 was relaunched in the United States. When it was reintroduced into the U.S. market, ProHeart 6 had more narrow restrictions on the age of dogs to which the drug could be administered and mandated additional record-keeping and client information/consent requirements. However, with the continued improvement of the safety record since the re-release, these additional restrictions were lifted in 2013. In 2019, ProHeart 12 was approved by the FDA as the first 12-month heartworm preventative. Although the ProHeart 6 and 12 injectables protect against heartworm infection, they do not clear an infected dog of either the adult heartworms or the circulating microfilariae. Also, although the moxidectin in ProHeart 6 and 12 kills adult and migrating larvae of the hookworm, they do not prevent reinfection of hookworm for the full 6 or 12 months depending on the product that is used. Both of these injections are required to be administered in the office by a trained veterinarian or veterinary technician. Benzimidazoles. Like the macrolides, benzimidazoles are a rather large collection of antiparasitic drugs developed in the 1960s from the prototype compound thiabendazole. These drugs were used in both human beings and animals, especially livestock, for the treatment of a wide variety of nematodal infections. Because of the greater spectrum of activity of newer anthelmintics and insecticides, this group has decreased in popularity for veterinary use. However, the relatively low cost of the drugs still makes them attractive for livestock operations, and paste products are often incorporated into rotating treatments for horses. All the benzimidazoles act by attacking special proteins in the parasite cells called B-tubulin. B-tubulin is involved in a wide variety of cellular functions, including cell division and maintaining cell shape, cell motility, cell secretion, and intracellular transport. By interfering with the function of B-tubulin, benzimidazoles disrupt the normal cellular function and eventually kill the parasite. Although mammalian cells also have B-tubulin, it is different from the parasite's B-tubulin, preventing benzimidazoles from binding as readily to the mammalian S-tubulin, and hence providing a wide safety margin and selective toxicity for this class of antiparasitics. The action of benzimidazole on the parasite cells usually takes up to 24H to kill the cells, and it may take multiple exposures to the drug over 3 or more days for some benzimidazoles to achieve their optimal killing effect on the parasite. Therefore, some dosage regimens of benzimidazoles require the pet owner or livestock producer to administer the drug on consecutive days. The B-tubulin mechanism of action is generally safe for mammalian cells for the reasons stated previously. However, rapidly dividing mammalian cells in the fetus may be affected by benzimidazoles because of the cell's dependence on properly functioning B-tubulin to make the microtubules that aid cellular division. Teratogenic effects, i.e. birth defects, have been noted at very high doses of selected benzimidazoles, e.g. 4 times the normal dose, when given early in pregnancy, especially to sheep. Teratogenic effects range from malformation of the limbs to abortion. Thus, some but not all benzimidazoles are contraindicated for use in some species during early pregnancy. The package label or drug insert for the individual drugs will provide more specific details. Benzimidazole compounds can usually be recognized by the azole suffix of the chemical name. In addition to the prototype thiabendazole, other benzimidazoles used in North America include fenbendazole, Panacor, Safeguard, oxybendazole, Anthelcide EQ, albendazole, Valbazen, and Febantel, Drontal Plus. Other benzimidazoles besides these are used in the United Kingdom, Australia, and other countries. Many of these products are formulated as pastes and solutions for use in the control of equine intestinal parasites. Most also have applications in cattle and other food animals, but little application today in companion animals except Febantel combined with the anticestodal drug praziquantel and the antinematodal pyrantel in the drug Drontal Plus. Thiabendazole is the prototype drug for this group of antiparasitics, and like other members of this drug family, it has a wide range of activity against ascarids and strongyles in horses, cattle, sheep, and goats. Because of the age of the product, parasitic resistance to this drug has been documented, limiting its use in equines and livestock. The drug is safe when used at recommended dosages and rarely causes significant side effects, although the dying parasites may produce an inflammatory reaction. In addition to its antiparasitic activity, thiabendazole is unique in that it has some anti-inflammatory and antifungal activity. For this reason, thiabendazole is sometimes added to otic, i.e. ear medications, e.g. the Tresiderm, and topical products. Fenbendazole, Panacor, and Safeguard for dogs, horses, and livestock, has a wide spectrum of activity against nematodes and a variety of other parasites. Fenbendazole is effective against a limited number of species of tapeworms, Taenia pisiformis in the dog, but should not be used as a general cesticide, iamodisum tapeworm-killing compound, unless the particular species of tapeworm has been identified. In horses and livestock, it is administered once as an oral paste, oral solution, or granules added to the feed, whereas in the dog it is given as granules that must be mixed with food for 3 consecutive days. The manufacturer states that repeated administration is required with continued exposure to parasites, e.g. grazing in infected fields. Extra label dosages exist for livestock, exotics, and small pocket pet animals. Oxybendazole, Anthelcide EQ, has long been used as an equine dewormer to control both large and small strongylls, large roundworms, pinworms, and threadworms. It is administered as a paste in a syringe, adjusted for the estimated weight of the animal. Because horses in fenced pastures are typically re-exposed to parasites as they graze, the manufacturer recommends repeat treatment every 6 to 8 weeks. Albendazole, Valbazen, is used to treat livestock with a spectrum of activity that includes intestinal nematodes, lungworms, trematodes, flukes, cestodes, and protozoa. It is one of the benzimidazoles that is thought to have the potential for teratogenic effects, and it has been linked to bone marrow suppression because of its effect on rapidly dividing cells. Therefore, although albendazole is still used in livestock, it should not be used during the first 30-45 days of pregnancy because of the potential for teratogenic effects. These dates vary with the species of animal to which the drug is given. The manufacturer's information will list the specific date with the given species. Like most of the benzimidazoles, ivermectin and modern anticestodes have largely supplanted the need for albendazole in companion animals. However, some products still exist and are still used in livestock because of their antiparasitic spectrum, especially against protozoa, and their relatively low cost. Febantel, Drontal Plus, is a little different from the other benzimidazoles in that it is a prodrug, meaning that it must be converted by metabolism to the active form of the drug, which in this case is fenbendazole and oxybendazole. Febantel is not available as a standalone antiparasitic, but instead is combined with Pyrantel, an antinematodal, and Praziquantel, an anticestodol. Pyrantel Anthelmintics, Strongid Nemex Exodus are highly effective antinematodals and considered very safe. They are marketed as Pyrantel Pamoat and a more water-soluble salt, Pyrantel tartrate. Although Pyrantel products are labeled for use against common nematodes in dogs and horses, dosages exist in the veterinary literature for many species treated by veterinarians. Pyrantel mimics the effect an excessive release of acetylcholine would have on nicotinic acetylcholine receptors, nicotinic cholinergic receptors, on parasite muscle cells. The excessive nicotinic effect would cause an initial stimulation and spastic contraction of the parasite's muscles, followed by paralysis and death. The pleasant taste of liquid Pyrantel pamoate facilitates giving the oral suspension to animals by the veterinary profession or the client. Because of its safety and pleasant flavor, a large number of OTC Pyrantel products are also available to the general public in a wide variety of retail stores. For this reason, many pet owners will choose to worm their pets with these products. Because this drug is effective against ascarids, i.e. the roundworms, and hookworms, but has no activity against whipworms or tapeworms. Clients may not understand why their pet has tapeworms or whipworms when they have dewormed the dog at home with Pyrantel purchased OTC. Pyrantel products are used in horses continuously as top dressing on feed or solutions or pastes given by mouth. Other products are available for mixing with feed for other species like swine. The liquid suspensions of Pyrantel pamoate quickly settle to the bottom of the bottle, requiring these suspensions be thoroughly shaken and mixed before administration to ensure accurate measurement of the medication. Failure to thoroughly mix the suspension before each dose can result in underdosing when using the diluted concentrations at the top of the bottle or overdosing when using the more concentrated drug found at the bottom of the bottle. Pyrantel pamoate has been incorporated into several veterinary products to extend their spectra of activity. HeartGuard Plus combines the heartworm preventive ivermectin with Pyrantel. Drontal combines the anticestodol praziquantel with Pyrantel. And Drontal Plus combines the antinematodal activity of Pyrantel and the benzimidazole Febantel with the anticestodal activity of Praziquantel. A related compound found in some livestock medications is Pyrantel morantel. Although less used than Pyrantel, it is very similar to it in its spectrum, mechanism of action, and characteristics. Imodepside, Profender, is a relatively new topically applied antiparasitic developed specifically for cats. It is not marketed as a standalone product, but packaged instead with Praziquantel for its anticestodol properties. Imodepside is the first of this family of antiparasitics to be released, and it works by a mechanism that is different from most of the other antiparasitics. Instead of stimulating or inhibiting a neurotransmitter's postsynaptic receptor located on the parasite's muscle or neuron, it stimulates a receptor found on the presynaptic neuron itself that releases an inhibitory neurotransmitter, neuropeptide. This released neuropeptide prevents muscles from contracting, resulting in flaccid paralysis of motion muscles, inability to take in food, and death. Although this mechanism sounds similar to those mechanisms involving GABA or glutamate receptors and chloride influx, neither GABA nor glutamate neurotransmitters is the neuropeptide that produces the inhibition. Imodepside is applied at the base of the skull of cats with a special applicator. Unlike some topical external parasite drugs, imodepside is designed to be absorbed systemically. To avoid contact with children after application, children should not pet or touch the cat in the area of the application site for 24H. According to the manufacturer's package insert, pregnant women or women who may become pregnant should avoid contact with the drug and should wear disposable gloves when applying. This concern arises from studies done in rats and rabbits that suggest imodepside may interfere with fetal development in those species. Piperazine is a vermicide found in most of the once-a-month deworming medications sold in grocery stores and pet shops. Piperazine is very safe but has a very narrow spectrum of activity and is only effective against ascarids. Like Pirantel, when pet owners use piperazine products to deworm their pet, they may believe there is no reason to submit their pet's fecal sample to check for parasite eggs. The veterinary technician should inform the client that piperazines do not kill hookworms, tapeworms, whipworms, or Protozoa, coccidia that commonly infect dogs and cats. Unlike Pirantel, which kills both ascarids and hookworms, piperazine does not kill hookworms, and severe hookworm infestations can kill a young puppy because of blood loss. Thus, the false sense of security puppy owners might get from using a piperazine product is even more dangerous than when they use an OTC Pirantel product. Piperazine works by stimulating GABA receptors, resulting in the opening of chloride channels in the parasite muscle and an influx of chloride, making the inside of the muscle cell more negative, hyperpolarized, and resulting in paralysis because the muscle cannot depolarize and contract when stimulated to do so. For this reason, the drug is considered a vermifuge because it does not directly kill the worms, but paralyzes the ascarid adult worm, preventing movement against the normal peristaltic waves of the intestinal tract. The result of the ascarid paralysis may appear as a wriggling mass of live roundworms passed with the stool. If the worm is only partially paralyzed and is not passed out with the normal movement of feces, the ascarid may survive the dose of piperazine and go on to reinfect the animal. Piperazine is very safe for the host animal, including puppies, and some sources state that it is for all intents non-toxic under normal circumstances. But piperazine does not kill the migrating larvae of roundworms. Thus, within a few days to weeks, the larvae will return to the GI tract, where they will mature into new adults. Hence, OTC versions of piperazine require regular retreatment with the drug on a monthly basis to eliminate the newly emerged adult worms. Therefore, although it is very safe, piperazine is not a very effective antiparasitic for eliminating common GI tract parasites. Levamisole is an antinematodal that has been around for 50 years, but, like most older Anthelmintics, has fallen out of favor because of its fairly narrow safety margin, its limited effectiveness against migrating larval stages of nematodes, and the development of resistance by many parasites, especially those affecting horses. It is still used for some livestock, e.g. there are swine formulations, and surprisingly this drug has been used in the past as a microfilaricide for heartworm disease. More recently, levamisole has been in the literature not as an animal anthelmintic drug, but as an adulterant to cut cocaine. To cutting cocaine with an adulterant means to dilute the cocaine with an additional substance to increase sales profit. It has been speculated that levamisole continues to be preferred because of its increased neurotransmitter effect associated with cocaine. However, levamisole in humans can cause necrotizing lesions in the vasculature and diffuse inflammatory lesions throughout the brain, which is part of the reason why this drug was discontinued for use in human medicine decades ago. Anticestodals, and cesticides are drugs that are designed to destroy tapeworms. Because the head or scolex of the tapeworm can regenerate a tapeworm if only the segments or proglottids are removed, modern cesticides destroy all of the tapeworm, including the head. Though removal of all tapeworms is the goal in small animal therapy, tapeworms do not have a significant effect on the feed-to-weight conversion in livestock, and so are typically not treated with a specific anticestodal. Instead, some of the less expensive antinematodal compounds like the benzimidazoles may have a secondary anticestodal activity. In horses, some tapeworms can cause damage around the ileocecal valve in the GI tract, resulting in intussusception and colic. The removal of tapeworms in dogs and cats is not only preferred by the owner but also is necessary because of the potential for zoonotic disease, i.e., disease transmitted from animal to human. For example, the larvae of the dog tapeworm Echinococcus granulosus can form large cysts within the human liver. The two major drugs, praziquantel and epsiprantel, both work by similar mechanisms. Both drugs cause increased permeability of the cell membrane to calcium with subsequent loss of intracellular calcium resulting in paralysis of the parasite. In addition to the paralysis, the protective covering of the tapeworm becomes damaged, resulting in leakage of essential nutrients and unveiling antigens against which the host's body can produce antibodies to help kill the parasite. Praziquantel is a veterinary and human anticestodal drug that was the first of its kind to be classified as a modern anticestodal drug. In veterinary medicine, it is marketed in injectable, tablet, and liquid oral forms for use in dogs and cats, Dronsit, and combined with other antiparasitics in several antinematodal veterinary products. E.g., Drontal is praziquantel plus Pirantel pamuat. The advantages of praziquantel are its efficacy with a single dose and its activity against a wide range of cystodes, including E. granulosus, mentioned earlier. Because praziquantel results in the entire worm, including the head, disintegrating, owners usually do not see tapeworm proglottids passing in the feces like they might after killing roundworms. Although a single dose of praziquantel is effective against most of the common tapeworms of dogs and cats, elimination of the tapeworm Dipylidium caninum requires elimination of fleas from the host and the immediate environment because fleas are involved in that tapeworm's life cycle. Failure to prevent flea infestation is likely to result in reinfection with this tapeworm. Although praziquantel is effective against the adult tapeworms, it is not ovicidal, i.e., capable of destroying the tapeworm eggs. Therefore, after administration of the drug and the death of the parasite, microscopic tapeworm eggs may continue past in the feces for a period of time. Because accidental ingestion of tapeworm eggs by human beings poses a potential public health hazard, the veterinary professional should instruct the pet owner to follow proper hygiene procedures, i.e., washing hands, after cleaning a cat litter box or disposing of feces that might be contaminated with tapeworm eggs. Diarrhea and vomiting are occasional side effects of praziquantel use in dogs and cats. The injectable form of praziquantel has a slightly greater incidence of vomiting than the oral form. Pain at the injection site, ataxia, drowsiness, and weakness have been reported in cats and dogs. After receiving the injectable form, epsiprantel Cestex was introduced into the veterinary market several years after praziquantel. It is an oral anticestodal effective against Taenia and Dipylidium tapeworms, but, unlike praziquantel, it is not available in an injectable form. The manufacturer does not list epsiprantel as being effective against Echinococcus species, which can produce cystic liver disease in humans after the tapeworm eggs are accidentally ingested. Even so, epsiprantel has high efficacy against the Echinococcus tapeworm, although there is some evidence that most doses have the potential to leave behind residual worms. Unlike praziquantel, epsiprantel is not absorbed from the GI tract to any significant degree, which minimizes the risk of systemic side effects while still retaining its effective anticestodal activity. Like praziquantel, epsiprantel causes digestion of the entire tapeworm within the bowel, so there is little evidence of the tapeworm in the stool. Antiparasitics used in heartworm treatment. Heartworms are helminths that produce clinical disease in both the dog and the cat. Because this disease is commonly encountered in veterinary medicine and because its treatment is more complex than that for other internal parasites, it is discussed separately from the other internal parasitic worms. Heartworm infection has been diagnosed all across the world and in all 50 of the United States, including parts of central Alaska. It is transmitted by mosquitoes from dogs and wild canids that create endemic areas or pockets of infection in each state. Heartworm disease is different from heartworm infection. Heartworm infection refers to the presence of the Dirofilaria immitis adult worms in the heart and pulmonary arteries, but heartworm disease does not occur until the infection is significant enough to produce clinical signs. Most of the significant clinical signs are attributed to damage and obstruction of the pulmonary arteries caused by the physical presence of juvenile and adult heartworms. The presence of these worms causes inflammation of the pulmonary intima, i.e., the inner lining of the vessels, resulting in proliferation or thickening of the intima, which narrows the pulmonary blood vessels, further restricting blood flow. As the worm burden, i.e. the number of heartworms, increases, the adult heartworms will begin to fill the right ventricle, then the right atrium, and finally even the large vena cavae that return blood to the right side of the heart. The worms present in the ventricles and atria can interfere with the closing function of the right atrioventricular valve, AV, the tricuspid valve, resulting in the blood from the ventricle ejecting back up into the atria when the ventricle contracts. This backward flow can increase the pressure inside the right atrium and vena cavae, eventually raising pressure in the capillary beds of the liver and kidney and interfering with normal organ function. Because of these effects, heartworm disease can result in an inability of the heart to adequately pump blood to the lungs, failing the right side of the heart, i.e., right-sided congestive heart failure, and, in severe cases, death. In addition to the damage caused by the presence of the heartworm itself is the damage caused by a gram-negative intracellular bacterium called Wolbachia pipientis that infects heartworms and microfilaria young and contributes to the clinical disease associated with heartworm infections. The relationship between Wolbachia and Dirofilaria is called symbiotic because it appears that each organism benefits from the presence of the other. Similarly, the removal of one organism seems to decrease the viability of the other. The damage to the body caused by Wolbachia comes from certain proteins found on the Wolbachia species bacteria, Wolbachia surface protein, WSP, that stimulate an inflammatory response, adding to the inflammation and clinical signs caused by the heartworm. Apparently, the increased inflammation that occurs at the point the adults or microfilariae are killed is likely due in some significant part to WSP. Therefore, part of the treatment regimen for heartworm disease includes antibiotics to eliminate this bacterium and reduce its effect when killing the heartworm adults. Although D. immitis creates pathology by its irritating physical presence in the pulmonary vasculature, the more severe pathology occurs when the worms die of an adulticide drug or from completion of their life cycle. Dead and dying worms produce severe clinical signs by two mechanisms: the release of inflammation and immune-stimulating proteins and the blocking of pulmonary arteries by chunks of dead decaying worms passing from the heart or larger pulmonary arteries to the smaller arteries where the emboli, i.e. any detached mass or object traveling within the blood vessels, lodge and obstruct blood flow. The increased velocity and turbulence of blood through the heart and vasculature when an animal exercises can shake loose larger pieces of plaque to form bigger emboli that obstruct more major pulmonary arteries, producing a far greater inflammatory response. Thus, after dogs are treated with an adulticide, exercise restriction is mandatory. In addition to the emboli, the dead worm stimulation of the immune response can result in lung pathology, even in areas of the lung not directly affected by the physical presence of worms. Overall, the time of adult heartworm decomposition after treatment is the time of greatest risk of death of the animal from heartworm disease treatment. The cat is not a natural host for D. immitis, and therefore D. immitis infective larvae injected into the cat by the mosquito typically do not survive. However, if a sufficient number of infective larvae are injected, some will develop into adult heartworms. The worm burden in cats is typically only around 2 to 5 adult worms, and the worms have a shorter lifespan of only 2 to 3 years. But even a small number of adult heartworms in the cat can produce significant clinical disease because of the much smaller pulmonary vasculature in the cat compared with the dog. Some cats with adult heartworms living in their pulmonary vasculature may not show clinical signs, which suggests that the live adult heartworm is not the primary source for clinical signs in the cat. Clinical signs tend to appear when the infective larvae first become very young adults and arrive in the pulmonary vasculature, where they produce an inflammatory process in the pulmonary arteries and the lung tissue itself. Many of the arriving immature adult worms die, and their death contributes significantly to the inflammatory process. The inflammatory process in the lungs affects not only the vasculature but also the airways, producing coughing and an asthma-like syndrome called HARD, or heartworm-associated respiratory disease. This acute phase of heartworm disease in the cat is often mistaken for feline asthma. As the remaining heartworms mature, the inflammatory reaction actually subsides and the clinical signs of HARD begin to lessen or disappear. The adult heartworm may suppress the immune inflammatory response, allowing the cat to tolerate the presence of the few adult heartworms in the pulmonary vasculature. However, once the adult heartworms die at the end of their shortened life cycle, they cause a return of the inflammatory reaction, and the emboli produced by the decaying dead worms can potentially produce severe clinical signs and even death. Thromboemboli, i.e. emboli made of thrombocytes or platelet clots, will spontaneously form and contribute to the occlusion of the pulmonary arteries. Cats usually are not treated for adult heartworms because the resulting emboli from degenerating dead worms would cause obstruction in the major pulmonary arteries because of their relatively small size, and because cat pulmonary arteries have far fewer branches than the dog, with less collateral circulation, to compensate for the emboli obstruction. Instead, treatment in the cat focuses on reducing the initial inflammatory reaction from the immature worms, then allowing any adult heartworms to die one at a time on their own, and controlling the subsequent inflammatory response and embolic effect from the dead worm. The pathology of heartworm disease and the protocols needed to treat it are complex, and our understanding continues to evolve as we learn more. Likewise, we are still learning how best to treat the complicating factors such as the effects of Wolbachia in the dog and the multitude of triggers for immune and inflammatory responses in both the dog and cat. Therefore, the veterinary professional should be familiar with the most recent discoveries and therapeutic advances reported in the current literature and by the American Heartworm Society. Different stages, different drugs. To effectively eliminate heartworm from the mammalian host, multiple drugs affecting different stages of the life cycle of Dirofilaria must be used. An adulticide is a drug used to kill mature adult heartworms that live in the pulmonary vasculature and the right chambers of the heart. Female adult heartworms produce microscopic young larvae called microfilariae, which circulate in the bloodstream of infected dogs and are taken up by mosquitoes when they feed on an infected dog's blood. Microfilaricides are drugs used to kill the circulating microfilariae produced by the adult heartworms. After the microfilariae have been ingested by a mosquito, they change to become infective third-stage larvae, L3. These infective larvae migrate to the head and mouth parts of the mosquito, through which they enter another dog's or cat's body the next time the mosquito feeds. The injected infective L3 larvae migrate through the body for several weeks and eventually reach the pulmonary arteries, where they mature to adult worms. Heartworm preventives are drugs given to kill these infective larvae, so they do not mature to adults. Generally, drugs used to treat one stage are less effective or not effective against other stages. For example, the adulticide drug used at the dose to kill adult heartworms is not effective against microfilaria or the infective L3 larvae. Most preventives are not particularly effective against adults, although with chronic high-dose therapy, they may have some effect. In addition to the antiparasitic drugs, antibiotics are used to kill the Wolbachia bacteria, and anti-inflammatory drugs may be used to reduce the body's reaction to the proteins or antigens that produce disease. Successfully treating heartworm disease requires using multiple drugs that are given in a particular order to effectively eliminate all stages of the heartworm from an infected dog. Heartworm adulticides. Melarsomin imidazide is the only approved heartworm adulticide for use in the dog since 1996. It is far less reactive to tissue than its predecessor, and even though it is an organic arsenic type of drug, it does not produce toxicity or liver damage to the degree that the previous arsenic adulticide drug did, probably because of the lower dose of arsenic required to kill adult heartworms with melarsomin than the previous drug. Melarsomin's mode of action against heartworm is unknown, but it is considered to be 98% effective against adult Diamitis in the dog. Female heartworms are considered to be more resistant to the effects of the adulticide than male adult heartworms, which means fewer treatments of the adulticide will kill off the males and leave a single-sex population of female heartworms. The spacing of the doses of melarsomin is targeted specifically to ensure the death of the more robust female worms. Although melarsomin is quite effective against adults Diamitis, it does not kill young adult heartworms less than 4 months old. Although melarsomin can kill adult heartworms in the cat, melarsomin is not used in the cat because of the risk of emboli and severe inflammation from disintegrating dead adult heartworms, thoroughly obstructing the cat's pulmonary arteries. In addition, dogs with a class 4 level of heartworm disease or Caval syndrome should not be treated with melarsomin. Caval syndrome refers to the vena cavae and means the pulmonary vasculature and heart are so physically full of worms that they extend back into the vena cavae. Killing off that mass of adult heartworms at once would most likely result in death when the decaying worms bombard the lungs. Dogs with class 4 or Caval syndrome require surgical removal of the worms from the vena cavae and the right side of the heart by threading a loop down the right jugular vein and into the heart, where worms are snagged and physically removed 1 or 2 at a time. Melarsomin is packaged as an injectable product that comes in a powder that must be reconstituted just before administration. The manufacturer is very specific that the drug must be administered intramuscularly, IM, but can only be injected into the epaxial muscles, which are muscles located dorsally on either side of the spinal column. Specifically, the drug should be injected into the epaxial muscles between the 3rd and 5th lumbar vertebrae, 1 to 2 in lateral to the center of the spinal column, as marked by the vertebral dorsal spinous process. Dogs that weigh less than 10 kilos 20-month-old should be injected with a 23-gauge 1-in needle. Larger dogs should be injected with a 22-gauge 15-in needle. The longer needles are required to place the drug deep within the belly of the epaxial muscles. The small gauge of the needle, small gauge equals narrower needle diameter, helps prevent drug leakage from the injection site. Although far fewer side effects occur with melarsomin than the older adulticide it replaced, swelling and pain at the injection site are frequently reported. It is important to ensure that the entire drug is injected into the site before withdrawing the needle to avoid additional pain and swelling at the injection site. The manufacturer recommended dosage regimen is to give 2 injections of melarsomin in the epaxial muscles separated by a 24-HH interval. However, evidence is emerging that a 3-injection protocol may be more effective. The 2018 report of the American Heartworm Society stated that the 2-injection protocol killed about 90% of the heartworms. This does not mean that 90% of the dogs treated this way were cleared of heartworms. It means that the worm burden was reduced by 90%, leaving approximately 10% of the heartworms in the patient. An alternative protocol gives 1 injection of melarsomin, followed by a month of rest, and then the 2-injection method 24H apart. Is this protocol said to kill 98% of the worms? The 3-injection protocol was already part of the approved method for administering melarsomin to small dogs as a means of reducing the risk for serious emboli in their relatively smaller pulmonary arteries. But regardless of the size or severity of the heartworm disease, the American Heartworm Society now recommends the 3-injection protocol for all dogs and has a detailed protocol on their website for treatment. The treatment guidelines clearly state the recommended protocol for treating heartworm disease based on the stage of the disease. Levamisole is a drug mentioned with the anti-nematodal drugs that at one time was used as an inexpensive but less effective alternative adulticide to the older arsenical drug. Although levamisole did kill adult heartworms to some extent, the inconsistent number of worms killed and the side effects, primarily CNS-related, made it a risky drug to use, and today, with the availability of melarsomin, its use is almost non-existent. However, because levamisole is inexpensive and still available, veterinary technicians may occasionally hear of an animal, typically an economic hardship case, being treated with this drug to reduce, but not eliminate, adult heartworms and clear microfilariae from the blood. The macrolide insecticides discussed previously, e.g. ivermectin, selamectin, milbemycin, have been shown to reduce the number of adult worms when given over several months. It is presumed that exposure to these drugs over prolonged periods reduces the lifespan of the adult heartworm and can kill infective larvae up to the immature adult stage. However, the American Heartworm Society does not recommend this approach because older adult heartworms are not very susceptible to the macrolides and may take up to 2 years or longer of continuous administration of the drug before 95% of the adult heartworms are eliminated. During this prolonged administration of the drug, the pathology in the lungs, pulmonary vasculature, and heart would continue to progress. The American Heartworm Society recommends this therapy throughout the recommended treatment to prevent further infection during treatment. The animals should be strictly exercise restricted during this entire treatment time to reduce the degree of inflammatory reaction after the worms die. Additionally, the use of the macrolides by themselves has the potential to put selection pressure on the parasites, allowing strains of heartworm resistant to macrolides to emerge. Heartworm microfilaricides. As of the writing of this text, there is only one approved microfilaricide, and that is the topically applied moxidectin found in the product Advantage Multi. Moxidectin was mentioned with the antinematodes and is part of the milbemycin branch of the macrolide family of endectocides. All of the macrolides or macrocyclic lactones, the ivermectins and milbemycins, have the potential to reduce or eliminate microfilariae produced by the female adult heartworms. In addition to the microfilariae, which would be the larval stage 1, L1 of the life cycle, macrolides are effective against the L3 and early L4 larval stages before the heartworm arrives in the pulmonary vasculature. Unfortunately, there is a period of time in the L4 stage of heartworm where the macrolides may not be effective, but the parasite is still too young to be eliminated by the adulticide melarsamine. Thus, there exists the potential for some L4 stage larvae to survive and grow into new adult heartworms if the macrolides and melarsamine are given close to the same time. The recommended protocol for the American Heartworm Society, mentioned at the end of this section, is designed to close that gap in treatment. Macrolides can cause a rapid decrease in the microfilaria, and the sudden mass death of this larval stage has the potential to produce a very strong inflammatory reaction in some dogs. The approved topical moxidectin microfilaricide did not produce any significant adverse reaction in dogs with high microfilaria count, according to laboratory studies and field studies conducted to receive FDA approval. However, such reactions have been reported with other macrolides when they were used as microfilaricides. If extralabel ivermectins or milbemycin products are used in dogs with high microfilaria counts, it is advisable to pretreat the animals with antihistamines or corticosteroids to reduce the inflammatory reaction set off by the dead microfilariae. The diluting of large animal ivermectin injectable products for use as microfilaricides in dogs is not recommended because the lack of accuracy of diluting such concentrated products can result in a dose that may be subtherapeutic and ineffective or so high as to be toxic. Heartworm preventives. The heartworm preventives are targeted against the mosquito-injected infective L3 larval stage and the I4 stage up to the young adult heartworm. The older daily heartworm preventive drug, diethylcarbamazine, DEC, which was administered as chewable tablets, has been discontinued. Therefore, all current preventives are products that are more conveniently dosed at monthly or 6-month intervals. Table 122 shows the heartworm preventives currently available in the United States. Many of the macrolide preventive drugs come in forms that have other anthelmintics added, e.g. Pyrantel, to expand the spectrum of their approved uses and provide the consumer with products that conveniently kill internal parasites, e.g. GI worms, and external parasites, e.g. fleas. Because these products change constantly, the veterinary professional must keep abreast of each new product or each new approved use of old products to understand the mechanisms and potential side effects. The individual macrolide products were also discussed in the antinematodol section. Ivermectin is the most widely used macrolide heartworm preventive, with a monthly dose of 0.06 mg/kg, much lower than the microfilaricidal dose, 0.05 mg/kg. This dose is well below the toxic level mentioned in the antinematodal section, minimizing the risk of adverse reactions in most breeds, including collies. Nevertheless, the manufacturer recommends observing animals for 8 hours after administering ivermectin as a preventive dose. The formulation approved for cats, HeartGuard for cats, comes in chewable cubes, packaged by weight class for owner convenience. Selamectin Revolution, administered topically, is another heartworm preventive but has not been combined with other products for broad-spectrum antiparasitic effects. Its approved spectrum includes hookworms, roundworms, adult fleas, ear mites, ticks, and sarcoptic mange mites, but it is ineffective against tapeworms. As with all macrolides, selamectin is absorbed systemically over days after topical application, with better absorption in cats than dogs. Once dried, the topical application is unaffected by bathing or swimming, making it convenient for pet owners. Selamectin is approved for heartworm prevention in both dogs and cats, with minimal adverse effects in MDR mutation collies even at 10 times the dose. The main adverse sign observed was hypersalivation, which was not severe even at high doses, indicating a wide safety margin. Milbemycin oxime, found in products like Interceptor, Sentinel, and Trifexis, is an oral monthly heartworm preventive sharing characteristics with ivermectins. It is non-toxic to dogs with the MDR1 mutation at doses up to 20 times the recommended amount and may help control raccoon roundworms, Bailey ascaris procyonis. Ingestion of B. procyonis eggs can cause severe, sometimes fatal migrations in humans, leading to liver damage, blindness, coma, or death. Milbemycin oxime reduces the parasite burden in dogs and decreases the risk of environmental contamination and human infection. Moxidectin is available in oral combination products like Advantage Multi, as well as injectable formulations, ProHeart 6 and 12, administered monthly or over a year. The injectable form is only for dogs aged 6 months and older, administered subcutaneously, with injection site reactions linked to dose size. After ProHeart 6 was temporarily withdrawn and reintroduced, it was subjected to Risk Map, a surveillance plan for minimized risk management. This plan restricted use to dogs under 7 years of age, required detailed owner consent, and mandated veterinarian-only administration with specialized training. In 2013, restrictions eased, allowing use in dogs over 7 years, removing client consent requirements, and enabling veterinarian technician administration with certification. The current risk map requires healthy dogs older than 6 months to receive the drug, with vaccination avoidance around the same time due to severe allergic reactions like anaphylaxis. Doxycycline for treating Wolbachia. Doxycycline is a lipophilic member of the tetracycline group of antibiotics, see Chapter 10. Because of its lipophilic nature, it can penetrate heartworm adults and larvae to reach the symbiotic bacteria Wolbachia living within D. immitis. When doxycycline kills the Wolbachia bacteria in L3 and I4 larval stages, the larvae die. The administration of doxycycline also reduces the number of microfilariae produced by the adult female heartworms. The microfilariae that were produced appeared normal, but were unable to develop into adult worms after they were taken up by the mosquito and molted into the infective 13 larval stage. Because the WSP is thought to contribute to pulmonary and kidney inflammation, killing the Wolbachia with doxycycline before administering the melarsamine adulticide resulted in less pulmonary injury or pathology from the dead adult heartworms. Thus, doxycycline is now included in the American Heartworm Society's treatment protocol for canine heartworm disease. It has been suggested that if a dog with adult heartworms cannot take the arsenical adulticide melarsamine, a combination of monthly heartworm preventive plus 4 weeks of doxycycline, 10 mg BD, can reduce, and with repeated treatments, perhaps clear adult heartworms over several months. The disadvantage of this approach using doxycycline is that exercise would need to be restricted for the entire time the animal was taking this drug combination. Additional drugs used in heartworm treatment. Glucocorticoids are anti-inflammatory drugs that help control the signs associated with inflammation of the pulmonary vasculature and the lungs secondary to emboli and immune-stimulating proteins. The American Heart Association recommends treating with a glucocorticoid like prednisone for initial stabilization if the dog is clinically ill from its heartworm disease. The recommendation is to also administer prednisone at the time of melarsamine treatment to reduce inflammation and help reduce the pain associated with the injection. Antihistamines are also sometimes administered to further reduce the histamine-mediated part of the inflammatory reactions. American Heartworm Society 2018 Protocol. Recommendation. The protocol for heartworm treatment today is very different from the standard protocols traditionally used. This protocol uses the 3-injection method for adulticide treatment described previously. Step 1, Day 1. A confirmed diagnosis and determine whether microfilaria are present. Begin exercise restriction. The more clinical signs, the stricter the restrictions need to be. And stabilize the dog if it has life-threatening clinical signs secondary to heartworm infection. Administer a dose of a monthly heartworm preventive. If microfilaria are detected, pre-treat with antihistamine and glucocorticosteroids to reduce the risk of anaphylaxis. Monitor the patient for at least 8H to monitor for anaphylaxis. Apply an EPA-registered canine topical product labeled to repel and kill mosquitoes. Dispense glucocorticosteroids per the guidelines if the dog is symptomatic. Step 2, Days 128. Administer doxycycline, 10 mg for 28 days. And Step 3, Day 30. Administer a dose of a monthly heartworm preventive. Step 4, Days 3160. A 1-month wait period to allow time for the Wolbachia surface proteins and metabolites to dissipate before killing the adult worms. Step 5, Day 60. And give injection number 1 of melarsamine, i.e. adulticide. Begin prednisone on a decreasing dose for 4 weeks. Restrict exercise strictly. Step 6, Days 1991. And give injection number 2 of melarsamine, i.e. adulticide. Give injection number 3 24H later. Begin prednisone on a tapering dose for 4 weeks. And continue exercise restriction for 6 to 8 weeks after the last melarsamine injection. Step 7, Day 120. And test for the presence of microfilaria. Reference guidelines, if positive. Continue a year-round heartworm prevention program. Step 8, Day 365. Antigen test 9 months after last melarsamine injection. Screen for microfilaria. As more is understood about heartworm disease in both the dog and the cat, new products and protocols will be introduced. The information provided in this section will provide a foundation for understanding not only how current drugs and protocols work, but also how new heartworm products or new protocols might be similar or different from established medications and procedures. Each sentence can be long if the input requires it, but must not exceed 30 words. If a sentence is longer, split it into 2 or more natural sentences without altering the content. Antiprotozoals. Protozoa are single-celled organisms that most frequently cause GI disease, but can also produce disease in almost every other organ system. Antiprotozoal drugs in veterinary medicine are most commonly used against Coccidia, Giardia, Toxoplasma, causes toxoplasmosis and Sarcocystis neurona, the agent of equine protozoal myeloencephalitis (EM). There are many other protozoa, e.g. Balantidium and Tamoeba, that are less commonly encountered in veterinary patients, and there are other compounds used to treat those. This is especially true for poultry and avian livestock, in which Coccidia plays an important economic role in production. But the focus on this section will be on the most commonly used antiprotozoals against the 4 protozoan groups listed earlier. Sulfonamides. The sulfonamides are antibiotics discussed in Chapter 10. They were the first drugs used to treat Coccidia species that infect the GI tract of both large and small animals and are still one of the main drugs used to control these protozoa. Animals acquire Coccidia both by ingestion of food or water contaminated with oocysts, i.e. egg cells, or by eating a rodent that is infected with Coccidia. Thus, environmental decontamination is often necessary to reduce reinfection with Coccidia. There is one solo sulfonamide product, sulfadimethoxine, Albon, 2 veterinary potentiated sulfonamides, sulfadimethoxine or metaprim, Primor, and sulfadiazine trimethoprim, Tribricin, and 1 human potentiated sulfonamide, sulfamethoxazole trimethoprim, Septra, Bactrim, that have been used to treat Coccidia. 9. The sulfonamide and the potentiator compound, trimethoprim or ormetaprim, both work on the same metabolic pathway needed by Coccidia to produce folic acid. By working at 2 different parts of the pathway, the combination products are more coccidiocidal than the sulfonamide might be working alone. Sulfadimethoxine is the only sulfa approved by the FDA for treating Coccidia in dogs and cats, but all of the sulfas are effective against these protozoa. Trimethoprim sulfadiazine was the first potentiated sulfonamide used in veterinary medicine and is one of the most widely used because of its long history. Trimethoprim sulfamethoxazole is a potentiated sulfonamide, and therefore any use in veterinary patients would be extra label. However, because it has a very similar spectrum to the veterinary trimethoprim sulfadiazine and because there are inexpensive generics available, this human drug is being used in veterinary medicine for the treatment of Coccidia and other microbes in small animals. Although these more modern sulfonamides are more soluble in water than the older sulfas and hence less likely to precipitate out of the urine and form crystals in the urine, i.e. crystalluria, it is still recommended that any patient receiving sulfonamides be given free access to water at all times. Veterinary technicians and veterinarians must always be watchful for signs of keratoconjunctivitis sicca, KCS, or dry eye whenever sulfa drugs are used. A compound related to trimethoprim and ormetaprim called pyrimethamine is combined with sulfadiazine to treat the protozoan Toxoplasma gondii, the cause of the potentially zoonotic disease toxoplasmosis in dogs and cats, and S. neurona, the protozoan that causes EPM. Amprolium, chorid, is a feed or drinking water additive that is commonly used as an antiprotozoal in calves and avian species to treat Coccidia. It is structurally similar to thiamine but does not possess thiamine's intrinsic vitamin activity. Thus, in the presence of amprolium, competitive antagonism between amprolium and thiamine occurs, and thiamine absorption into the coccidia is inhibited. The parasite dies from thiamine deficiency. Use of amprolium in large doses for extended periods can also result in thiamine deficiency in the host animal. Benzimidazoles. The benzimidazoles were discussed with the antinematodal drugs, and as mentioned previously, some also have antiprotozoal properties. Specifically, the 3 benzimidazoles, albendazole, fenbendazole, and fibantel, the prodrug that is converted to fenbendazole, are used primarily against Giardia. Giardia is a mobile protozoan that lives in the lumen of the GI tract and moves by use of a long flagellum. It is a problem in dogs, cats, and cattle, but also poses a human health hazard via contaminated drinking water supply. Giardia is often difficult to diagnose because common fecal examination techniques, e.g. fecal flotation, will not identify the flagellated protozoa. Thus, animals can be undiagnosed shedders of Giardia and potential sources for human zoonotic disease. Albendazole valbazin is a broad-spectrum benzimidazole anthelmintic approved for use on intestinal worms of cattle and sheep, but has also been used in an extra-label manner to treat Coccidia in these species, and dogs and cats. However, albendazole is teratogenic, i.e. causing birth defects, so it is not to be administered to pregnant livestock in the first stages of pregnancy. Bone marrow toxicity, lethargy, and loss of appetite have been reported in the dog and the cat from albendazole use, and therefore its use in these species is discouraged but not contraindicated. Fenbendazole Panacur Safeguard is an FDA-approved oral product used to remove intestinal parasites in dogs and some carnivorous, omnivorous, exotic, or zoo animals. A slightly different formulation is also available for similar anthelmintic activity in cattle and horses. Fenbendazole products are not approved for use in treating protozoa, but extra-label use of fenbendazole has shown excellent activity as a multi-day, orally administered antiprotozoal for treatment of Giardia in dogs. It appears to be well tolerated by dogs and cats, with only some mild side effects, e.g., vomiting, diarrhea reported. Although fenbendazole's efficacy against Giardia is very good in dogs, it is far less effective in cats, with only 50% of cats treated with fenbendazole being cleared of Giardia after 3 weeks of treatment. Fenbendazole is considered to be an effective antiprotozoal for treating Giardia in cattle. Febentel is only available in a combination product with praziquantel and pyrantel, Drontal Plus, that is approved for the removal and control of intestinal worms in dogs but not cats. Because the Febentel is converted to fenbendazole and oxfendazole, it would be expected to have good activity against Giardia. Even though it is an extra-label use, the combination of the Febentel product has been effective against Giardia in cats. This product would be too expensive to justify its use to control Giardia in livestock species. Metronidazole was mentioned with the Antimicrobials, Chapter 10, as an oral drug that is bactericidal against anaerobic bacteria in the gut and was sometimes used to treat chronic diarrhea of unknown origin. Because metronidazole is also effective against Giardia, as well as other less common protozoa, it is one of the drugs of choice for treatment of giardiasis, i.e., infection with Giardia in dogs and cats. It is protozoicidal by disrupting the helical structure of protozoan deoxyribonucleic acid, DNA, and interfering with other key molecules needed by the protozoa. Metronidazole eliminates Giardia cyst shedding in cats and dogs with 5-8 days of continuous treatment. The length of treatment varies with the dosage used. Although metronidazole is effective at removing Giardia in cattle, the family of compounds to which metronidazole belongs has been suspected of producing mutations and being potentially carcinogenic, which means they are strictly prohibited from being used in any animal that could be used for human food consumption. 10-oral metronidazole is notoriously bad-tasting and readily dissolves in the saliva, making the drug easy to taste and therefore difficult to administer to animals, especially cats. In an attempt to reduce the ability of the metronidazole to dissolve and create an unpleasant taste, it is combined with benzoic acid to create metronidazole benzoate. Although cats are susceptible to benzoic acid toxicity, at the dosages used to treat Giardia in cats, toxicity is unlikely to occur from the benzoate. As mentioned with the antimicrobials, metronidazole can produce neurotoxicity, manifested as staggering, nystagmus, circling, and seizure-like activity. It is suspected that these neurologic signs are caused by inhibition of the inhibitory neurotransmitter GABA, see benzodiazepines, resulting in overstimulation of the CNS. The signs are temporary and reverse over several days without any long-term after-effects. Clindamycin, antirobe, is an antibiotic belonging to the lincomycin antibiotic group that is usually used for treating anaerobic bacterial infections in small animals. Clindamycin is one of the drugs of choice for treating disseminated toxoplasmosis in dogs and cats. The dose used to treat toxoplasma is higher than the dose cited on the label for use in treating anaerobic bacteria and must be given daily for 4 weeks, but the higher dose and longer duration are apparently tolerated. At the higher doses, clindamycin also becomes coccidiocidal after a few days of treatment. Clindamycin may be combined with potentiated sulfonamides or pyrimethamine to treat other protozoa, ionophores. Ionophores were briefly mentioned in Chapter 4 on GI drugs. They are called ionophores because they can combine with selected ions and transport them across biological membranes. Ionophores found their first uses in poultry to treat coccidia, a use that continues today. Because of their unique mechanism of action, resistance has been much slower to develop in ionophores than in other antibiotics. 2 of the ionophores used as feed additives in veterinary medicine to control coccidia in poultry, cattle, and other small ruminants are lacillocid, Bovatec, and monensin, rumensin. It is important that horses not be given access to feed containing monensin because the ionophore will cause degeneration of skeletal and cardiac muscle that could lead to death. In the fall of 2014, the accidental addition of monensin and lacillocid to horse feed at an equestrian center in Florida resulted in 22 animals being poisoned. Over the course of several weeks, all died because of permanent damage to the heart caused by the ionophores. Ponazuril marquise is approved for use to eliminate the proto-20A-S neurona that causes EPM in horses. Sarcocystis is picked up by the horse by drinking water, grass, or feed contaminated by cats, opossums, or other wildlife that can shed the sporocysts of sarcocystis. The protozoa cause damage in the spinal cord or the brain, and can produce almost any neurologic sign depending on which area of the spinal cord is affected. Most often signs reflect spinal cord damage and can appear as lameness, staggering, incoordination, ataxia, or weakness in one limb or one side. and muscle atrophy of those muscles supplied by damaged nerves. Lesions in the brain cause head tilt, depression, and facial paralysis. Although ponazaril and pyrimethamine can kill the protozoa, the damage caused is often irreversible. External antiparasitics. External antiparasitics, or ectoparasiticides, are used to control flies, grubs, and lice on livestock. Flies, both bots and maggots, on horses, and fleas, ticks, and mange mites on companion animals. In addition to decreasing skin disease in companion animals or increasing weight gain in livestock by controlling these external parasites, another benefit is the control of diseases such as Lyme disease, bubonic plague, and Rocky Mountain spotted fever that can be transmitted from animals to humans through insects. As mentioned previously, the EPA is charged with regulating topically applied pesticides or insecticides that are minimally absorbed into the body. However, for any external parasiticide that is administered by mouth or injection into the body, the FDA would have jurisdiction because that compound would be considered a drug. Topically applied products that need to be systemically absorbed to produce their beneficial effect would also be regulated as a drug by the FDA. Although the word insecticide technically applies only to six-legged true insects, it often is extended to cover arachnids, i.e. spiders, and adult ticks and mites, i.e. acarines, which all have 8 legs. Insecticides and external antiparasitics are available in many formulations and delivery methods, including collars, powders, dips, aerosol sprays, pump sprays, baths, foggers, foams, pour-ons, spot-ons, and even roll-ons. Most of these formulations are designed for the convenience of application for the companion animal owner, or in some cases they are marketed in a novel delivery system designed to set the product apart from its competitors. Table 123 shows a list of the more common or mainstream brands of flea and tick products a veterinary technician is likely to encounter. In contrast to the individual animal application in companion animals, insecticides and external antiparasitics for livestock are designed for ease of application to large groups or herds of animals. Hence, the ectoparasiticides may be incorporated into rubbing bars and dust bags that deliver a dusting of the chemical that kills or repels insects. Other formulations for livestock include pour-on products that are absorbed into or through the skin, sprays, dips, impregnated ear tags from which insecticide diffuses into the body, and feed additives. Although products for companion animals are designed to be applied in a carefully controlled manner and dose for each animal, livestock products are formulated based on the average amount of insecticide each animal is likely to acquire, but the actual dose varies considerably depending on the length of time or amount of chemical with which the animal comes in contact. The generic flea's life cycle can be summarized as follows, Fig 121. The female flea feeds on the pet's blood and produces thousands of eggs in a normal lifetime. These eggs fall off the pet and within a few days will hatch larvae in the pet's environment. Flea larvae then create pupae, cocoons, in which they can remain for months. When the environmental conditions are right, the young adult flea will emerge from the cocoon and seek the pet or the pet owner on which to feed and continue the life cycle. Because some flea products only stop one component of the flea life cycle, e.g. just the egg or just the adult, failure to kill the other stages of the life cycle simultaneously will allow adult fleas to continue to plague the pet, in the case of compounds that kill larvae or affect eggs, or will only temporarily eliminate the flea problem until the eggs hatch or the new adults emerge from the pupae. As stated previously, the veterinary technician must thoroughly understand this life cycle and how the individual drugs affect it to provide appropriate advice for the client. All modern insecticides or ectoparasiticides, regardless of which external parasite they target, are neurotoxins in some manner. Like many of the internal parasiticides and the endocannabinoids, the ectoparasiticides typically do one or more of their different actions. Inhibit a neurotransmitter, acetylcholine. Enhance a neurotransmitter, GABA. Block a neurotransmitter's receptor, cholinergic receptor, or enhance a neurotransmitter's receptor. GABA receptor opens chloride channels, nicotinic cholinergic receptor for acetylcholine. Knowing whether the target receptor or the neurotransmitter of the ectoparasiticide is excitatory or inhibitory, and whether the ectoparasiticide enhances or reduces the neurotransmitter effect, will allow the veterinary technician to understand how the product works and the possible toxicity signs that could be seen in the animal. Organophosphates and carbamates. Organophosphates, OPs, and carbamates are considered to be old insecticides once widely used in veterinary medicine but now only occasionally found and more commonly experienced in veterinary medicine as toxicities from exposure to agricultural or garden pesticides. These compounds are still found in a few animal ectoparasiticide products in North America as the OP compounds tetrachlorvinphos in flea collars, chlorpyrifos, diazinon, coumaphos, and pyrimifos, all found in cattle ear tags, and as the carbamate compound propoxur, e.g. zodiac tick collars, In the United States, the companies producing propoxur-impregnated flea and tick collars reached an agreement with the EPA in 2014 to stop producing such collars and to terminate sales of existing stock by April 1, 2016. Other OP and carbamate products for animals are found and purchased outside the United States and Canada, where insecticidal use may be less stringently regulated. Thus, it is conceivable that the veterinary technician may encounter OP or carbamate ectoparasiticides. A more thorough briefing on these compounds can be found in veterinary toxicology resources. OPs and carbamates, which are two chemically different types of insecticides, are usually grouped because of their similar mechanisms of action, effects on insects, and toxic effects. These products still have several agricultural applications, including use on crops, on garden plants to control aphids and other pests, in the soil to control lawn grubs, and on nursery trees, and can be found in stores where garden supplies are sold. A tip-off that a product contains OPs or carbamates can be found in a container's warning label to physicians stating that the product contains a cholinesterase inhibitor and should be treated as such in cases of accidental contact or ingestion. The term cholinesterase inhibitor comes from the way OPs and carbamates bind to acetylcholinesterase, the enzyme that normally breaks down the neurotransmitter acetylcholine to terminate its action at the receptor site. With the acetylcholinesterase inhibited by OPs or carbamates, the acetylcholine neurotransmitter released by the axon continues to stimulate muscarinic and nicotinic types of acetylcholine receptor sites. Overstimulation of the muscarinic cholinergic receptors for acetylcholine located in the heart, bronchioles, GI tract, and other organs produces clinical signs associated with parasympathetic nervous system stimulation, which include slutty signs, salivation, lacrimation, urination, defecation, dyspnea, i.e., difficult breathing because of bronchoconstriction and increased respiratory secretions, and emesis. Bradycardia and meiosis are also characteristic signs of overstimulation of the parasympathetic nervous system and are associated with muscarinic receptor overstimulation from the action of OPs or carbamates. Overstimulation of the nicotinic cholinergic receptors produces clinical signs related to the neuromuscular junction, NM, where nerve axons contact skeletal muscles. Overstimulation of the nicotinic receptor initially produces muscle tremors that progress in severity until the nicotinic receptor stops responding to the overstimulation, resulting in a block of axonal depolarization waves to the voluntary or skeletal muscles. Thus, toxicity signs associated with nicotinic receptor stimulation appear initially as tremors, progressing to shaking, and then to ataxia and paralysis. Because the diaphragm is a skeletal muscle, the diaphragm and the intercostal muscles that help lift the rib cage during inspiration can also be paralyzed, contributing to respiratory failure. Death in toxicity cases is usually because of hypoxia from being unable to adequately ventilate, i.e., exchange oxygen for carbon dioxide. Pupils in these animals may be dilated, especially in cats. Treatment of acute OP toxicity consists of removing any insecticide remaining on or in the animal and blocking the parasympathetic effects. Atropine at 10 times its typical pre-anesthetic dose is still the drug of choice for reversing slutty clinical signs because it is a muscarinic cholinergic receptor antagonist blocker that decreases the effect of the excessive acetylcholine at the muscarinic receptor site. Atropine does not block nicotinic cholinergic receptor sites except at very high doses, so nicotinic signs of toxicosis may not significantly improve from atropine administration. Pralidoxime, also called 2-PAM, reverses OP toxicosis by separating the OP from the acetylcholinesterase molecule, thereby freeing the enzyme molecule to work again. Pralidoxime only works as long as the bond between the OP and the acetylcholinesterase remains loose. Once the bond becomes a strong covalent bond or ages, the pralidoxime can no longer separate the OP from the acetylcholinesterase. 2-PAM can be obtained from human hospitals, emergency centers, and sometimes first responder centers. Because OP and carbamates have such a low margin of safety, because there are so many newer and safer external parasiticides, and because the EPA is cracking down on any use of these products in a way potentially harmful to humans, e.g., children coming in contact with flea collars impregnated with these products, it is doubtful these products will continue to be manufactured in the future. But for now, there still exist products available for animal use, and the veterinary technician needs to be aware of their actions and potential toxicity. Pyrethrins and pyrethroids constitute the largest group of OTC insecticides marketed for use against external parasites and common household insect pests such as flies and mosquitoes. Unlike OP and carbamate insecticides, most of the pyrethrins and pyrethroids have a large therapeutic index, see Chapter 3, and are selectively toxic, meaning that the dose that is effective, i.e., kills the parasite, is much smaller than the dose that produces toxicosis in the animal host. Pyrethrin in its purest form is considered to be an old insecticide, a natural insecticide derived from chrysanthemum flowers. As an ectoparasite product, pyrethrin has a quick knockdown effect, as evidenced by the way flies drop or fleas fall from an animal sprayed with pyrethrins. However, the killing activity of pyrethrins is not as marked as the stunning effect, and the immobilized flies or fleas may recover after several minutes. For that reason, the basic pyrethrin molecule has been modified to enhance the insecticidal effect. These modified pyrethrin-like insecticides are called pyrethroids. There are many pyrethroids available for veterinary, agricultural, and household use. A wide variety of pyrethroids can be found in horsefly sprays. Most pyrethroids can be recognized by the thrin suffix at the end of the compound name, e.g., permethrin, flumethrin, tetramethrin, deltamethrin, cyfluthrin, cypermethrin, and cyphenothrin. A couple of exceptions to this rule are fenvalerate and etofenprox, used in some OTC insecticidal applications. Pyrethrin and pyrethroids are topically applied and are lipophilic but large molecules. They tend to penetrate through the superficial layers of the skin, but cannot penetrate very deeply, and hence are not absorbed systemically. These products are regulated by the EPA and not the FDA, making them available as OTC products. Although pyrethrin and pyrethroids probably have multiple actions on receptors, the main mechanism of action is by locking open the sodium channels that normally allow sodium ions to move into the neuron to initiate depolarization of the nerve. The duration of this effect is dependent on the type of pyrethroid, with some pyrethroids keeping the channel open for a short period of time and others locking it open for much longer. The difference in effects results in different causes of death signs in the parasite and different clinical signs of toxicity if it occurs in the host. By opening the sodium channel, the neuron will depolarize. If the channel is allowed to close again, the cell will be allowed to repolarize, meaning that the effect of the pyrethroid in opening the sodium channel again will produce a rapidly repetitive cycling of depolarization-repolarization. In the parasite or the toxic host animal, this will produce muscle tremors, hyperactivity, and seizure activity. If, however, the sodium channel is opened and then locked open, the neuron or muscle will depolarize once but be unable to repolarize and hence will be non-responsive to any further stimulation. The net effect in this case is paralysis of the muscle and shutdown of neuronal firing. So-called type I pyrethroids, e.g. permethrin, resmethrin, produce the hyperactivity type of response, and the type 2 pyrethroids, e.g. fenvalerate, produce the paralysis type of syndrome. As mentioned earlier, pyrethrins and pyrethroids for the most part have very selective toxicity because of the poor absorption into the body from the skin, the affinity these compounds have for insect sodium channels versus mammalian sodium channels said to be 1,000 times greater, and because mammals have many enzymes that can break down pyrethrins and most pyrethroids. Although pyrethrins are very safe for mammals, fish readily absorb pyrethrin insecticides through their skin, do not have the same enzymes as mammals do to readily break down pyrethroids, and can easily become poisoned and die. Therefore, pyrethrin and pyrethroid use around koi ponds, fish farms, and aquaculture establishments must be carefully controlled to prevent the spray or application from settling into the water. Partially because of the potential toxicity and effect on fish, some pyrethroids previously found in veterinary products in the past are no longer available because of EPA restrictions. E.g., EPA stopped all sales and distribution of resmethrin as of December 31, 2015. Fortunately, most pyrethrins and pyrethroids currently in use tend to degrade in the environment fairly quickly, minimizing the effect of these compounds if they are sprayed onto groundwater runoff that passes into streams, lakes, or rivers. Synergists are compounds added to the pyrethrin products to enhance their insecticidal effect. The synergists most commonly used with pyrethrins are piperonal butoxide, PBO, and another called MGK-264. These synergists are generally safe, but PBO has been reported to cause neurotoxicity signs in cats licking their treated fur. Because pyrethroids usually have sufficient insecticidal activity by themselves, they are not often combined with a synergist. To enhance the disruption of the flea life cycle, some pyrethrin and pyrethroid flea products now include insect growth regulators, IGRs, which are compounds that retard or stop the development of flea eggs or flea larvae without directly killing the flea. These products are discussed at the end of this chapter. As stated at the beginning of this section, there are many pyrethroid products, some of which are OTC, some of which are available to veterinarians, and others that are limited to use by licensed pest control operators for premises and environmental use. Veterinary technicians should be aware of the characteristics of a smaller subset of selected pyrethroids of medical or toxic significance encountered in veterinary medicine that are listed later. Permethrin is a common product in many household fly and insect killer sprays, e.g. Raid, is a component of several OTC horsefly sprays, is used as pour-ons and spot-ons for livestock and horses, is impregnated into cattle ear tags, and is also one of the more widely used pyrethroids in veterinary medicine. In addition to multiple off-brand products, permethrin is found in a few mainstream canine-only products like Canine Advantix 2 and Activil Plus. Part of the appeal of permethrin as a topically applied pesticide is that in addition to being an insecticide, it is a repellent that can keep insects from landing on horses, cattle, or small ruminants in the first place. It also has fairly effective tick-repelling action, which reduces the chances of being bitten by a tick and infected with tick-borne diseases like Rocky Mountain spotted fever. Permethrin is incorporated into some materials used to make outdoor clothing to have inherent fly or tick-repelling characteristics and goes by marketing names like No-Fly Zone or Buzz-Off Fabric. The topically applied canine products Canine Advantix 2 and Activil Plus contain very high concentrations of permethrin, 45% to 65%, and ingestion after grooming can cause toxicosis in cats. Cats are inefficient at metabolizing drugs that depend on drug conjugation with glucuronide, which is a main pathway for permethrin metabolism. Permethrin itself is the toxic element versus its metabolites, so slow metabolism in cats predisposes them to toxicity. There are many reports of permethrin toxicity in cats after applying high-concentration canine products onto them. Because permethrin is a type I pyrethroid, clinical signs reflect rapid depolarizations, presenting as tremors and seizures. A report exists of permethrin toxicosis in a cat occurring 48 hours after 2 large dogs in the household were treated with a concentrated permethrin spot-on. Although canine permethrin products warn against exposure to cats, veterinary technicians must stress to owners that cats should not contact treated areas for 24 hours after treatment. Permethrin is very toxic to fish, so care must be taken not to contaminate aquariums or koi ponds after application. Though not especially toxic to birds, spray products with permethrin may contain other compounds that can damage the respiratory tract if inhaled by birds. Permethrins are very toxic to honeybees and other beneficial insect pollinators. Cypermethrin is a type 2 pyrethroid found in household insect products and approved for use in dust bags for cattle, horses, and small ruminants. It is used in poultry to control biting lice in chickens, ducks, and turkeys, and in insecticide ear tags with PBO to boost effect in cattle. Cypermethrin has limited use in small animals. Fenvalerate, like cypermethrin, is a type 2 pyrethroid implicated in cat deaths after OTC treatment with Hart's blockade for cat spray. Currently, fenvalerate is not present in companion animal products, and livestock products containing it are becoming scarce. Etofenprox combined with fipronil or other ectoparasiticides appears in some flea and tick products for dogs and cats, including OTC sprays like Adams Plus. It is also used in house foggers, but label instructions vary. Some products specify not to use on or around cats, especially at higher concentrations. Tetramethrin is found in OTC yard sprays and indoor foggers, used for fleas, ticks, ants, and mosquitoes, sometimes providing protection up to 7 months. Tetramethrin is also included in pyrethroid combinations for killing and repelling flies, gnats, and mosquitoes in horse sprays. Cyfluthrin is a 4th-generation pyrethroid used in cattle ear tags as a monthly pour-on and as a premises spray to control lice and flies, with some repellent properties for horses. There are no current small animal applications for cyfluthrin. Flumethrin, related to cyfluthrin, is part of the 8-month flea collar for dogs and cats called Seresto, combined with imidacloprid. There are dozens of other pyrethroid compounds used in household sprays, premises sprays, horsefly sprays, mosquito foggers, and livestock products, but the compounds listed here provide a core of pyrethroids for comparison. Amitraz was one of the first effective agents for treating demodectic mange in dogs. The Amitraz formulation for demodectic mange is still available in a liquid form, Mitaban, for dips or sponge-on baths. It is a legend drug, restricted by law to use only by or on the order of a licensed veterinarian due to its potential toxic nature if used improperly. It is not entirely clear how amitraz kills ticks or mites, but it acts as an Oz receptor agonist similar to sedative drugs like xylazine and detamidine. Stimulating the A2 receptor in the brain decreases norepinephrine release, leading to sedation due to decreased excitatory effects in the brain. The sedative effects of amitraz are consistent with its activity as an Oz receptor agonist. Amitraz also inhibits monoamine oxidase, MAO, an enzyme involved in breaking down and recycling norepinephrine. Many behavior-modifying drugs are MAO inhibitors, so amitraz should not be used with MAOIs, tricyclic antidepressants, or serotonin reuptake inhibitors. The increased use of psychotropic drugs in veterinary medicine heightens the risk of interaction with amitraz, more so than in previous years. Wearing gloves during application decreases contact with the skin and reduces risk of intoxication from topical exposure. Animals should be fully wetted with the amitraz mixture and allowed to dry without rinsing or toweling off after treatment. Treatments for demodicosis typically require 3 to 6 baths spaced 14 days apart. After dipping, animals may show CNS depression, sedation, and incoordination lasting 24-72 hours. Some dogs may experience hypothermia from impaired thermoregulation due to the dip, so they should be placed in padded cages to prevent heat loss. Pruritus often occurs for several days post-treatment, caused by the body's reaction to mite death as a foreign protein. Amitraz is ineffective against fleas but can kill and repel ticks. It has been impregnated into a collar, preventic tick collar for dogs, that prevents attachment, causes detachment within 48 hours, and kills ticks for up to 3 months. A collar combining amitraz with pyriproxyfen and IGR for fleas is marketed as Preventic Plus. Amitraz formulations worldwide are used for mange mites, lice, and ticks in swine and cattle. Cat sensitivity to amitraz toxicity is high, so products containing amitraz should never be used on cats. Cats treated with canine-approved amitraz products have shown profound sedation, ataxia, and death. Large animal product concentrations in amitraz would easily be lethal to cats and pose toxicosis risks to dogs and horses. Disposal of discarded amitraz collars or parts can cause severe toxicity if ingested by dogs or children. Amitraz collars should be kept out of reach of children and pets, and discarded segments must be promptly disposed of to prevent accidental ingestion. If the dog loses the amitraz collar, it should be located and properly disposed of to prevent its becoming a toxic accident. If a dog loses its amitraz collar and begins to appear depressed or sedated, the owner should suspect amitraz toxicity from ingestion and seek veterinary help immediately. Death from ingestion of amitraz collars has been reported in both veterinary and human medical literature. Because amitraz is an alpha-2 receptor agonist, drugs like yohimbine, yobine, tolazoline, tolazine, and adipamezole antisidan can reverse many toxic effects caused by excessive sedation. These drugs are only available as veterinary medications. Since their half-lives are short compared to amitraz, multiple doses of these alpha-2 antagonists must be given to maintain reversal effects. The macrolides or macrocyclic lactones include the avermectin and milbemycin groups of drugs. They are considered insecticides and were discussed extensively as internal parasite medications. Ivermectin has been used extra-label in livestock and small animals for lice and mites, but is ineffective against fleas and does not kill ticks immediately. There is an ivermectin-based otic solution for ear mites in cats, Otodectes cenotis. Several ivermectin products are approved to treat lice and mites in cattle, and others control migrating fly larvae in livestock, horses, bison, and reindeer. In horses, ivermectin kills migrating larvae of Onchocerca, but dying larvae can cause skin inflammation, itching, and swelling. Pre-treatment with glucocorticoids can reduce the inflammatory reaction caused by ivermectin in horses. Because ivermectin has been available for a long time, generic brands flood the market today. Eprinomectin is an avermectin for large animals to treat lice, biting flies, fly larvae, and mites, available as Poron, Eprinex, and long-acting injectable products. The Poron has no withdrawal time for milk or meat due to minimal absorption, but the injectable has a 48-day withdrawal period and restrictions to prevent environmental impact. The injectable form must be given as a subcutaneous injection in the shoulder and not via IM or IV to avoid adverse effects. Underdosing can lead to parasite resistance, and the product is approved only for pastured cattle, not confined or intensively grazed cattle. Doramectin Dectomax is another avermectin for large animals used as a Poron or injectable in cattle and swine. It is used extra-label in dogs for dermatocosis, but severe adverse reactions, including death, have been reported, especially in MDR1 mutation breeds like collies. Selamectin, Revolution, is an approved topically applied avermectin for monthly use in dogs and cats for treating ear mites and adult fleas, and to prevent flea eggs from hatching. In addition, in dogs, it is indicated for treating sarcoptic mange and killing ticks. Unlike some of the other avermectins, selamectin has not been particularly successful in treating dematocosis, demodectic mange. The monthly duration of action against ectoparasites is thought to be because of sequestration, i.e., taking up and holding, of the selamectin in the sebaceous glands of the skin. This product is not used in large animals either for label or extra-label uses. Milbemycin oxime is part of the milbemycin macrolides and was originally developed as an agent against agricultural mites. Its only approved use for ectoparasites is for use as an otic preparation against ear mites in the cat milbemite otic. Although some early studies were done to investigate the possibility of using milbemycin oxime at a high dose to treat tough canine dematocosis cases, the results have been conflicting, with some improvement but no consistent results. Because there are amitraz products and other macrolides that may be more effective, milbemycin is not considered for extra-label use to treat dematocosis. Moxidectin is the other topically applied milbemycin macrolide and is FDA approved for use in cattle as Cydectin to treat cattle grubs, larvae of flies in the skin, mites, and hornflies, and as the monthly administered Advantage Multi in dogs and cats to treat fleas. In addition, moxidectin is approved for treating ear mites in cats and sarcoptic mange in dogs. The manufacturer advises that the topical application site of Advantage Multi should be isolated from other animals to prevent licking because the oral ingestion of moxidectin can produce severe side effects including coma and death. Moxidectin can be used in an extra-label manner to treat dematocosis in the dog. However, animals should be evaluated for MDR1 or ABCB1 mutation sensitivity to macrolides before using the recommended dose found in the literature. A weekly topical application of moxidectin is used in some countries outside of the United States to treat dermatocosis. Several extra-label dosages exist for macrolides, especially for exotics or wildlife species. Although the use of macrolides in an extra-label manner may be routine in some practices, it still warrants caution and intensive client education about the potential side effects of the product in that species. In many cases, little information is published regarding potential complications. Therefore, the veterinary professional is always obligated to inform the client that the medication being used is not approved for that species or for that particular use, and procure the client's permission to use the product in the prescribed manner. Informing the client of this risk does not protect the veterinarian against litigation if an animal dies or is injured because of the extra-label use of this or any compound, but it does facilitate the communication and partnership between the veterinarian and the client, especially if something does not go as planned. Fipronil was first marketed in 1996 for control of fleas, ticks, and biting lice in dogs and cats as the Frontline topical application, Frontline Top Spot, and Frontline Plus, and as a spray. It has since been incorporated into several other products, e.g., Frontline Tratac, Certifect, and Parastar, for monthly topical application, and is often combined with the IGR called methoprene to extend fipronil's killing effect on the adult fleas to other stages of the flea life cycle. Methoprene halts flea larval development and kills flea eggs by concentrating in the ovaries of adult fleas at the time the flea eggs are formed. Fipronil works as a neurotoxin in insects by blocking the chloride channels that normally open when GABA or glutamate receptors attached to the chloride channels are stimulated. By blocking the chloride ion influx, fipronil blocks the normal inhibitory effect the chloride ions would have on the neuron, and thus allows the neuron to fire more than normal, resulting in overstimulation of the neuron, hyperexcitability of the nervous system, and subsequent death of the parasite. The safety of fipronil is attributable to fipronil's much higher affinity, i.e., ability of the drug to bind, for combining with the insect's chloride channel on glutamate receptors than the chloride channel on mammalian GABA receptors. The topical liquid products of fipronil are applied on the back between the shoulder blades. Because it is soluble in fat, it dissolves in the skin's oily sebaceous layer and spreads across the skin surface via the animal's movements. Fipronil is stored in the sebaceous glands associated with the hair follicles. Apparently, this site acts as a depot of the compound that is then exuded back onto the skin surface. The residual effect of fipronil in efficacy trials indicated a residual insecticidal effect of at least 30 days even if the animal is bathed. Thus, fipronil products are typically marketed as once-a-month products. The binding of fipronil to the dermis, hair follicles, and sebaceous glands makes toxicity from licking unlikely after 24 hours. Clients and veterinary professionals should wear gloves when applying this product to prevent exposure to the drug. Any skin that contacts the fipronil product should be washed thoroughly with soap and water. Bathing, swimming, and contact with water do not diminish the effect of the fipronil products. However, the animal should not be bathed with shampoo until 48 hours after the application of the product. Fipronil is highly toxic to some types of fish and therefore must be used with caution to prevent accidental contamination around aquariums or pools of fish. Fipronil is also known to be toxic to rabbits, even though previous publications in the United Kingdom reported successful use of fipronil. Today, it is generally accepted that fipronil poses too great a toxic risk to rabbits to justify its use in that species. Although fipronil itself is well tolerated by cats, some of the combination products are very toxic because of the presence of amitraz or permethrin, which are known to be toxic to cats. Hundreds of years ago, European farmers were aware that tobacco extracts could be used on plants to kill common pests found in the gardens or on crops. Human medical cures from writings in the mid-1600s describe how tobacco juice could be used to kill lice on children's heads. And in the New World of North America, farmers were aware that tobacco dust or liquid tobacco extracts could be used as insecticides. The active insecticidal ingredient in tobacco is nicotine. Although tobacco has been used as a crude folk remedy for removing parasites in livestock, today modification of the basic nicotine molecule provides us with very safe and effective antiparasitics. These new nicotine products are called neonicotinoids, the term conveying new as neo, and nicotinoids meaning nicotine-like. The two compounds used in veterinary medicine are imidacloprid products like the Advantage brand, Advantage 2, K9, Advantix 2, Advantage Multi, and the 8-month flea and tick collar Seresto and Nitinpiram flea products like the orally administered Capstar. The name neonicotinoid, in reference to nicotine, also suggests the mechanism by which these antiparasitics work. As mentioned with the OPs, acetylcholine receptors come in slightly different shapes, with one type more likely to combine with nicotine, nicotinic cholinergic receptors, and the other type more likely to combine with a compound called muscarinic cholinergic receptors. The nicotinic receptors are found at the junction between motor neurons and skeletal muscles, the NM, and also in both the parasympathetic and sympathetic nervous systems. Compounds that mimic acetylcholine and stimulate nicotinic cholinergic receptors like the neonicotinoid insecticides have a biphasic response. Low doses stimulate the nicotinic receptor repetitively, producing muscle tremors and even convulsions. At higher doses and greater stimulation, neonicotinoids cause the nicotinic receptor to lock up and not repolarize again, essentially preventing impulses from traveling from the motor neuron to the skeletal muscle and producing paralysis of the muscle. Because the nicotinic cholinergic receptors are differently shaped in insects than they are in mammals, the neonicotinoids are quite safe because they bind much better to the insect receptor sites. Imidacloprid, Advantage Products and Seresto collar, was first developed for use in agriculture to control insects on crops. It was the first neonicotinoid to be used as a topical spot-on for control of fleas. Today, imidacloprid is found in multiple products, some of which are very safe for use in cats and others that have been combined with permethrin for its tick and repellent properties, and therefore are contraindicated for use in cats. Imidacloprid is applied to the back of the neck in cats or between the shoulder blades in dogs and over the rump area of large dogs. The drug is disseminated across the skin by the animal's movement. Imidacloprid is poorly absorbed through the skin and kills adult fleas on contact without the flea having to feed on the animal. The manufacturer claims 4 weeks of residual activity in cats, with a slightly longer residual effect in dogs. Some of the topically applied imidacloprid will be shed into the environment with skin, hair, and sebum. If it contacts flea larvae in the environment, it can have a larvicidal effect, helping to break the flea life cycle. Unlike fipronil and pyrethroids, toxicity to fish is low, according to the manufacturer. Imidacloprid is combined with the pyrethroid flumethrin in the 8-month flea and tick collar called Seresto. The tick repellent and tick-killing activity comes only from the flumethrin because imidacloprid has poor activity against ticks. The prolonged duration of activity comes from the way the collar releases the ectoparasiticides over an 8-month time period into the lipid layer of the skin. Like the other imidacloprid products, this product can be larvicidal against flea larvae in the environment if the hair, sebum, or skin of the treated animal comes into contact with the flea larvae. Note, any ticks that are already attached at the time the collar is applied usually have to be removed manually, as they will not die within the 48 hs it takes for the flumethrin to begin its repellent and tick-killing activity. As of this writing, Seresto was not available in Canada or Puerto Rico. Nitinpiram, Capstar, is an oral tablet used in dogs and cats to kill adult fleas. Nitimpyram claims to be faster in the onset of flea-killing activity, less than 30 min, than fipronil or imidacloprid, although the clinical significance of this difference may be minimal. Unlike imidacloprid, which is not absorbed appreciably into the body, nitinpiram is absorbed and works systemically to kill flea adults. Nitinpiram does not accumulate in tissues but is excreted rapidly and would need to be given on a daily basis to kill adult fleas continuously. One of the common uses for nitinpiram is for animals coming from a potentially flea-populated area that are entering a flea-free home, and the owners want to be sure that no adult fleas are brought into the environment. Kennels may use nitinpiram on animals at the time they go home as a means to eliminate any adult fleas the boarding animal may have acquired. An extra-label use of the drug is to kill maggot, i.e. fly larvae, infestation in necrotic wounds, such as those found in older outdoor dogs or cats with severely matted fur. The manufacturer warns that flea-infested pets treated with nitinpiram may increase their scratching for a short period after drug administration because the initial nicotinic receptor stimulation produces increased nervous system and muscle activity, making the fleas move around a lot on the animal's skin or even have seizure-like activity before they die. The increased flea activity can make the animal very pruritic, but the reaction is usually short-lived because the adult flea dies quickly. However, the veterinary technician should inform the owner of this temporary but common side effect, explain why this effect is occurring, and reassure the owner that it is not a drug reaction to the nitinpiram. Spinosins are a family of chemicals that were discovered by a scientist from Eli Lilly and Company who took soil samples containing crushed sugarcane from an abandoned rum still while on vacation in the Caribbean. The scientists sent them back to the laboratory as part of the effort to identify new chemical agents from natural sources. A few years later, it was found that the fermentation products of the bacteria Saccharopolyspora spinosa, isolated from the soil samples, had insecticidal activity. These isolated fermentation compounds were called spinosins, and the natural combination of the two principal spinosins created the chemical called spinosad, which takes its name from S. spinosa. Spinosad was initially marketed as a natural and environmentally friendly product for control of insects on turf, ornamental plants, and cotton. A few years later, the veterinary spinosad product Comfortis was released as a once-monthly tablet for control of fleas in both dogs and cats. Since then, chemists have modified the original spinosin isolates to create multiple variations that have been combined and tested for their insecticidal activity. From two semi-synthetic spinosins, Spinetoram was created, which is now available as Cheristin for cats as a once-monthly topically applied treatment for flea control. Spinosad and Spinetoram act just like the neonicotinoids to overstimulate nicotinic cholinergic receptor sites, producing the biphasic excitatory and paralytic effect that results in the death of the insect or parasite. However, these spinosins also work at a different site on the nicotinic receptor, and hence they are considered a different compound from the neonicotinoids, although their actions are very similar. Spinosad has a secondary effect as an antagonist on the GABA-linked chloride channels, reducing the inhibitory effect of GABA and increasing the hyperexcitability of the insect's nervous system. The manufacturer contends that the unique location on the nicotinic receptor site for Spinosad and Spinetoram will reduce the development of resistance to these compounds. Although side effects from these drugs are mild, there is an interaction between Spinosad and ivermectin. When ivermectin is used at higher extralabel doses to treat dermatocosis in dogs, the addition of Spinosad has been shown to produce mild to moderate signs of ivermectin toxicity, including tremors, ataxia, depression, mydriasis, blindness, and disorientation. Signs of ivermectin toxicity do not appear in animals that are taking ivermectin products for heartworm preventive, so there is no need to avoid the use of Spinosad with those products. However, the use of Spinosad is likely contraindicated if the dog is receiving higher than label doses of ivermectin to treat dermatocosis. Because Spinosad is taken orally, it is regulated and approved by the FDA, whereas the topically applied Spinetoram is registered only with the EPA as a pesticide. FDA products generally are legend products sold through veterinarians, but EPA products tend to be available through retail outlets. The isoxazolines are a group of insecticidal compounds developed in the early 2000s and released as two veterinary products in 2013, Afoxolaner and NexGard, and Fluorolaner, Brevecto. Both products work by inhibiting GABA-linked chloride channels, similar to fipronil, resulting in suppression of the inhibitory GABA neurotransmitter effect and resulting in overexcitation of the parasite's nervous system and death. The selective toxicity and wide safety margin are because of the differences in the shape of the insect GABA receptors versus the mammalian GABA receptors that result in isoxazolines combining much more readily with insect GABA receptors than mammalian GABA receptors. Afoxolaner NexGard is a prescription-only monthly soft chewable tablet approved for use in dogs to treat fleas and some ticks. This product is not approved for use in cats. In a field study, as part of the approval application process, one dog with a previous history of seizures experienced a seizure on the same day it received a dose of NexGard, and again the second time it received a dose of NexGard. It had a seizure a week after its third dose of NexGard. Another dog, also with a history of previous seizures, had a seizure 19 days after being administered a dose of NexGard. However, a third dog with a previous history of seizures showed no seizures during the clinical trial. Still, the manufacturer recommends using this product with caution in animals with a previous history of seizure activity. As a veterinary technician, it will be important to make sure that a warning is conveyed to the owner of any dog with a history of seizures. Fluorolaner Brevecto is also a prescription-only soft chewable tablet approved for dogs to treat fleas and ticks. However, instead of being given as a monthly medication, Fluorolaner lasts for up to 12 weeks for fleas and most ticks. It is only effective for 8 weeks against the Lone Star tick. Unlike Afoxolaner, Fluorolaner does not have the caution about using the product in dogs with a previous history of seizures, even though one dog during the course of clinical trials experienced a seizure 46 days after a second dose of Fluorolaner. Note: a new isoxazoline called Serolaner was released in April 2016 as the product Simparica. This product is a PO-administered monthly treatment for fleas and ticks for use in dogs only. Indoxacarb was developed for use in agriculture to overcome the resistance developed in crop insects and has also been used as the main insecticide in ant and roach baits. More recently, it has been marketed as a prescription-only, monthly, topical spot-on application for dogs and cats, Activil. It has also been combined with permethrin into a flea and tick spot-on application, Activil Tick Plus, that is for use in dogs only because the permethrin would be toxic to cats. The unique feature about indoxacarb is that the compound itself must be converted by enzymes within the insect to the active insecticidal ingredient. Because the enzymes needed for the activation of indoxacarb are not found in mammals, the product is safe from being activated in the host animals. Instead, mammals' enzymes change indoxacarb into non-toxic metabolites. Like all the other spot-on ectoparasiticides discussed, the product is placed on the skin, where it combines with the skin oils and spreads throughout the skin surface. Medium-sized dogs should have the product placed in 2 spots, shoulder blades and rump, and large dogs should have the product placed in 3 spots as directed by the manufacturer's drug insert information. Like many of the more modern flea products, the flea does not have to ingest a blood meal to absorb the indoxacarb. Instead, it is absorbed directly through the flea's cuticle. Once absorbed, it targets the sodium channels at a different site than do the pyrethroids. Instead of locking channels open like the pyrethroids, indoxacarb blocks the sodium channels like local anesthetics, such as lidocaine. The resulting paralysis produces flea death. Flea larvae in the environment that contact indoxacarb will also die. Applications of indoxacarb retain activity against fleas for at least 4 weeks and sometimes longer. Because the indoxacarb compounds are applied topically and absorption is minimal, these compounds are registered and regulated as pesticides with the EPA. As such, they are available for purchase without a prescription or order by a veterinarian. Insect growth regulators, the insect development inhibitors, and juvenile hormone analogs. GRs are a broad group of compounds that inhibit the maturation of the developing larvae of insects and ectoparasites but do not generally affect the adults. Because they target specific metabolic processes only found in insects, they do not affect mammalian cells. IGRs are broken down into 2 groups, the insect development inhibitors, IDIs, and juvenile hormone analogs, HAs. Lufenuron, a component of Sentinel products, is an IDI available in oral form. Lufenuron is absorbed and distributed throughout an animal's tissue fluids. When the adult flea bites and feeds on the animal, the lufenuron is taken into the adult flea and produces its effect on developing flea eggs and immature fleas. IDIs work by interfering with the deposition of chitin into the flea egg and the exoskeleton of the larva within the egg. Chitin is what accounts for the crunch, noticed when an insect is crushed, and is a key structural component of the exoskeleton. Thus, the larva may die because of the poor construction of the egg, or the larva may be unable to hatch out of the egg because of a lack of an effective egg tooth, which is also composed of chitin. Larvae that do hatch out of the eggs will be smaller and less likely to survive because of poor chitin deposition in their exoskeleton. Although chitin deposition occurs in adult fleas, the concentration of lufenuron achieved in adult fleas is insufficient to significantly affect chitin formation. Therefore, lufenuron is not effective against adult fleas. Because lufenuron targets chitin and because mammals do not have chitin in their bodies, lufenuron is considered a very safe compound. Because lufenuron affects eggs laid by adult fleas, there is a lag time of up to 2 weeks between when lufenuron treatment is started and when significant changes in flea reproduction are noted. Thus, for lufenuron to be effective to a client's satisfaction, it is highly recommended that a flea adulticide be used simultaneously to reduce the pet's aggravation from adult fleas. It is interesting to note that the enzyme system needed for chitin deposition, which is disrupted by lufenuron, is the same system used by some fungal agents for normal function. Thus, lufenuron has been mentioned as a possible treatment for superficial mycoses like ringworm in cats. However, clinical trials have been inconclusive as to whether or not lufenuron actually decreases the incidence or extent of ringworm in cat colonies. Methoprene and pyriproxyfen are 2 JHAs. These compounds work by mimicking the actions of natural juvenile hormones that retard development into adult insects. By delaying development, the larvae will eventually die. Methoprene is incorporated into the monthly topical products Frontline Plus and Frontline Tritac for control of fleas on dogs and cats. Methoprene is also found in the product Certifect for dogs, but Certifect also contains amitraz, which would be toxic if applied to cats. Many premise sprays contain methoprene, e.g. Precor, for treating carpets, rugs, and floors. It should be noted that methoprene is somewhat sensitive to direct sunlight, which may shorten its duration of action. Some premise sprays with methoprene claim to work up to 7 months. Pyriproxyfen, also known as Nylar, is the other JHA most commonly used in veterinary medicine. It is incorporated into spot-on applications like Advantage 2 K9 Advantix 2 and Biospot for cats, as well as room foggers, e.g. Verbac Knockout Fogger. As mentioned with methoprene combination products, some pyriproxyfen combination products like K9 Advantix 2 contain ingredients that are toxic to cats, e.g. permethrin, and therefore cannot be safely used in cats, even though pyriproxyfen by itself is very safe to use in cats. Insect repellents are used to repel insects and keep them off animals. Repellent formulations include horsefly sprays, cattle or livestock ear tags, and products applied to the tips of dogs' ears. Some of these products are insecticides and repellents. In horses and cattle, repellents prevent flies from laying eggs on the skin, reducing bot and warble infestations in the skin. In outdoor dogs, especially those with upright ears such as German Shepherds and Doberman Pinschers, flies sometimes continually bite the ear tips, producing oozing wounds and incrustations of black, scabby material, ear tip fly strike. Application of a repellent to the ears of these dogs reduces fly strike. Keeping ticks off animals or people is important so as to avoid tick bites that may transmit diseases like Lyme disease, which is transmitted by arthropods. Permethrin has natural repellent properties and insecticidal properties and was discussed at length with the pyrethroids. Butoxypolypropylene glycol is a repellent and a wetting agent and has been incorporated into equine fly repellents because it provides a shine that is of cosmetic value in show animals. Butoxypolypropylene glycol can cause dermal irritation if a harness or collar is applied over the area while the coat is still wet with spray. DEET is a common ingredient in repellent products formulated and approved for use in people. However, there are no products available for use in pets because toxicity has been reported, especially in cats. DEET was one of the products along with fenvalerate in the Heart's blockade product that caused the death of several cats. Because DEET is absorbed quickly when applied to the skin, people who use DEET in high concentration formulations have reported numbness of the lips or tingling associated with repeated use or application of large amounts. People may be tempted to use DEET on their pets, but they should not because of the risk for toxicity